Afternoon, everyone. This is Shami Chaudhary, a medical student here at the Aga Khan University, and a member of the Student Organizing Committee for the 3rd Annual Neuro-Oncology Symposium. First of all, I would like to formally welcome you all to the final session of the event. Let me begin by introducing Dr. Komal Sayed, who will be moderating this session, the theme being a patient-centric care. A little about Dr. Sayed before I hand over the floor to her. She is the director and founder of Brain Tumor Foundation of Pakistan, an NGO that reaches out to support all those affected by a brain tumor here in Pakistan. Thank you.
Thank you so much for the introduction. Just one clarification, I'm not a doctor, but I am the founder of the Brain Tumor Foundation of Pakistan. Thank you for having us. I will just share my screen and we will get started. Okay, well, assalamu alaikum and welcome to the patient-centric care session at the 3rd Annual Neuro-Oncology Symposium. As mentioned, I'm Komal Sayed, the founder of the Brain Tumor Foundation of Pakistan and moderator and host of this patient-centric care session, which will focus on the topic of providing holistic support in a brain tumor patient's journey. We will share and highlight perspectives of a brain tumor patient, caregiver, and patient advocate organizations, both from a global and regional lens, with the aim to find mechanisms on how we can all partner together to improve a brain tumor patient's journey. I'd like to thank Pakistan Society of Neuro-Oncology and Dr. Inam for inviting us to host a session at Trianos that focuses on this important topic. Our agenda is 2.5 hours today, and we have a host of exciting speakers and topics lined up for you. We also have a panel discussion in the last 40 minutes focused on how do we provide end-to-end holistic care for brain tumor patients and caregivers in Pakistan and other developing countries. Please share your questions in the chat during the speaker presentations, and we will address them during the panel discussion segment. Let's get started. I'm joined in our presentation on the Brain Tumor Foundation of Pakistan by Sohaib Mehta. Sohaib Mehta partners with us to further our agenda of providing non-medical support to brain tumor families in Pakistan. He's passionate about contributing towards social initiatives in Pakistan, like bridging the gap to provide holistic support to cancer patients. His 15 years of professional work experience puts him in a good position to follow this passion of his. Sohaib is supporting the Brain Tumor Foundation of Pakistan by helping us reach our target audience in the most definitive and effective ways. Together, we will represent the Brain Tumor Foundation of Pakistan today, and we will walk you through our story, our mission, work, and upcoming plans. The Brain Tumor Foundation of Pakistan is a non-medical, non-profit organization founded in 2020, and we work in partnership with PASNO. We consist of a small group of medical experts and volunteers who have come together with one mission. We have experienced the journey of a brain tumor either through our patients or directly through the diagnosis of a loved one, and we have seen ourselves how challenging and exhausting it can be to fight a brain tumor. Therefore, we are here to help those going through the journey today, to provide them with resources to make informed decisions, to share ways to support them when they need a community to rely on, and to keep pushing for research to improve the treatments available for all of us. This foundation has been set up in memory of my late husband, Mohammed Tahir Rafi, who we lost to a glioblastoma multiforme in 2015 in Karachi, Pakistan. As I look back at my time as a caregiver, the thing that strikes me most is that outside of the support we received from the incredible doctor team and immediate family and friends, we were essentially on our own. We had to figure out treatment options, gather second opinions, and discover the life-changing daily impacts of a brain tumor, which would catch us by surprise ourselves. And we did not know anyone else going through the same life experience as ours. Once memory loss seeped into our lives, the caregiver experience for myself became even more isolated. The Brain Tumor Foundation of Pakistan strives to make the journey of those impacted by a brain tumor in Pakistan today easier than it was for Taha and myself. Post Taha's passing, I assessed the support landscape available for people like us in Pakistan. I learned that in general, when it comes to non-medical support for cancer families and specifically for brain tumor families in Pakistan, the resources are far and few. In fact, there were and still are no other support organizations dedicated to brain tumors in Pakistan. Moreover, looking at the current challenges Pakistan is facing, where basic resources and infrastructure is destroyed in certain regions by natural disasters, such as the devastating floods in the country over the last few months, this heightens the need and the gap patients experience. Most awareness efforts are led by hospitals, and support, if offered, is for all cancers alike. We all know that the patient and caregiver journey for a brain tumor is very different from other cancers, with an impact to multiple dimensions of the physical, mental, and emotional well-being. And hence, care and support needs to be specialized as well. For Taha and me, there was no single point of resource catered towards Pakistan for newly diagnosed brain tumor families, where we could get basic and credible information. And I primarily reached out to websites and organizations outside of Pakistan to educate myself. Additionally, the concept of a support organization and support groups in general is still quite novel in Pakistan. Therefore, the opportunities to fill this gap in the support landscape for brain tumors needs to be plugged in the country. Every single touch point or lack of one impacts the patient and caregiver and their quality of life. If we look at quality of life as a central focal point, with better patient experience, patients will be more willing to come for routine checkups and leading to more opportunities for improved medical care. And this then opens the doors to provide more non-medical support in order to alleviate the burden on doctors and medical professionals, and the cycle in turn helps the patient caregiver experience. Separately, when basic support and quality of life metrics are met, we're able to focus more on research, which will eventually result in more treatment options within Pakistan for brain tumor patients. The cycle is continuous and it's interconnected. I'll now hand it over to Suhaib to share more about how our foundation addresses these gaps.
Thank you very much, Komal. Assalamu alaikum and hello to everyone. Thank you for joining our session today. I'll be taking you through the three key pillars of the foundation, the progress that we've made against each one of the pillars, and the pipeline of our future initiatives. Having looked at the current landscape of Pakistan and based on all the global learnings, our foundation has identified three key pillars to address the brain tumor support gap in Pakistan. First and foremost for us is to create awareness. As we all know, that at the very start of the journey, when a patient is noticing symptoms and is diagnosed, the first question that comes to mind is, what does this mean? How does it affect me? Our foundation aims to step in to support the patient and families in this initial phase with access to credible information. This pillar also works towards raising awareness across the country about brain tumors so that it's easier and quicker to diagnose them. The second pillar of non-medical support starts once a patient is undergoing treatment. They will definitely be looking for speaking to others going through a similar experience, or in some other situations, they might need to reach out for non-medical advice or one-to-one counseling. This pillar focuses on building a community and on providing a support system for anyone impacted by a brain tumor, either through their own diagnosis or that of a loved one. The third pillar of research is where we join hands with PASNO to further the efforts of research taking place in Pakistan for brain tumors. Another key focal point of this pillar is to work towards building a national brain tumor cancer registry in Pakistan. So if you move on and look at the work that we've done so far in the last 2 years against each one of the pillars, when it comes to awareness, in the past 2 years, we've worked on developing a digital content library that helps patients and caregivers understand what to expect at each stage of the brain tumor journey. Through easy to understand animations and recordings of medical experts, we have compiled informational videos along each step of the patient's journey in the local language Urdu with English subtitles. Our work today is primarily focused on online awareness, And in any given week, we are reaching out to as many as 2,400 Pakistanis through organic social media posts. We've also been inviting experts in various fields, such as nutritionists, physiotherapists, psychologists, to educate our community on the resources available to them. We've been partnering with doctors and other global brain tumor organizations on specific programs that they are launching, so that we can see how can those programs benefit our brain tumor patient community in Pakistan. We're also sending out monthly newsletters with upcoming event details to keep our community aware, informed, and engaged. Despite limited resources, we are continuously striving to improve our communication, to reach out to more and more people of Pakistan with content that is relevant and helpful for them. If we talk about the second pillar, which is on the non-medical support, we know that in the people of Pakistan in general only seek medical support when it comes to brain tumor and brain cancer. But we all know that the impact of brain tumor is on the complete life of the patient and the caregiver and the families. So there is a need for a more holistic end-to-end care system, which definitely involves non-medical support. So under this critical pillar, we've been conducting monthly virtual support groups that are attended by both regular and new members, where experiences are shared, advices are given, people are encouraged, open discussions are held across different topics impacting patients and caregivers. We have also put together closed WhatsApp groups and private Facebook groups to encourage conversations and discussions between patients and caregivers. In parallel, we are also working on piloting a patient navigator program in hospitals. We will be sharing more details on what a patient navigator is. Laura Hines will be from Brain Tumor Network will be taking us through that. But we all know how important it is for us to have on-ground presence in Pakistan, where in-person contact is extremely important. So by strengthening this pillar, in addition to supporting patients and caregivers, we also seek to help doctors and medical experts save their time and energy and focus more on providing the medical support. So in today's session, all our speakers and panelists will be sharing with us their experiences and knowledge around this pillar. If we look forward and talk about the future, the initiatives that we have in the pipeline, in the next 12 to 24 months, the Brain Tumor Foundation of Pakistan aims to focus on the following key initiatives. First and foremost, we would like to build partnerships with hospitals and brain tumor facilities across Pakistan. This includes building credibility and working closely with medical experts who can help us in driving our agenda across the three pillars of our foundation. Secondly, as mentioned before, we are planning to launch a national patient navigator program across every province of Pakistan. Thirdly, we would like to offer customized support in the hospitals partnering with us to the brain tumor patients and the families in need. Last but not the least, to make sure that we have sufficient presence on ground and we're able to support all the initiatives that I've mentioned, we are looking at starting fundraising to be able to scale up and grow our program further. So how can we partner together? Through our experience, we've all learned that neuromedical professionals and patient organizations go hand in hand. So how can the medical community support us? Definitely one of the ways is to help us increase the channels of communication so that we can raise awareness among the masses. Help us cover as many touch points, as many offline channels as we can. Secondly, please tell your brain tumor patients and caregivers about our foundation so that they can reach out to us to educate themselves and get the required non-medical support versus waiting to meet you at their next appointment with you. Thirdly, please share insights with us from your brain tumor patient bodies on how can we customize support from them? What are the pressing needs? How can we step forward and do more? Lastly, become brain tumor patient advocates and pilot new programs with us. The Brain Tumor Patient Navigator program is also an outcome of one of our partners, coming with us and asking us to develop a program like this. So we're working together with them. So we would encourage you all to please pilot new programs with us, share ideas with us so that we can move together on this journey. I will just close by saying that we have a long journey ahead of us. We have made strong strides so far, and we will be looking forward to your support on this journey moving forward. Thank you very much.
Thank you, Sohaib. And thanks for sharing our plans going forward. I'll move on to our next topic since we want to make sure we're on time. Our next topic is our keynote lecture on socioeconomic factors impacting a non-medical foundation. We have Dr. Nitin Garg, who will be presenting. Dr. Nitin is a consultant neurosurgeon and minimal access spine surgeon. He is also the founding director of the Brain Tumor Support Group and Awareness Foundation, India. BTSG is a not-for-profit organization with the aim to provide psychosocial support to brain tumor patients and their caregivers. And it was established in 2019 at Bhopal in central India. It is the first of its kind entity in India in the non-public sector setting. Various aspects like patient support group, monthly support group meetings, arranging for financial needs, and special tests are addressed at BTSG. In fact, BTSG has also been one of the key organizations that has supported the Brain Tumor Foundation of Pakistan as we tried to set up our support groups initially. Thank you, Dr. Nitin.
Thank you, Komal, thank you, Brain Tumor Foundation. And am I audible, Komal?
Yes.
Yes. And Pasno for bringing this patient-centric session. So I'll be presenting on socioeconomic factors which affect the non-medical foundation. Next slide, please. So I come from central India, from city of Bhopal, which is a very beautiful city of lakes, but also famous for a very infamous tragedy which happened in 1984 due to the leak of the methyl isocyanate, and thousands of people lost their life. I presently work in a corporate hospital at Bhopal. Next slide. So any illness, more so a brain tumor, has a significant potential to cause life disruptions. As we can see this spoke wheel, we generally manage the treatment part, but the other aspects like the family dynamics, financial, education, peer relations, future plans are generally not addressed by most of us. Next slide. A patient, around him, there are a lot of clinicians who work. However, I feel that, and we all know that the important missing link is the support groups and the psychosocial support, especially in our Asian countries. Next slide. So the present situation, as we can see, is the clinicians are focused more on training and providing medical care, and the hospitals are focused more on execution of these services. NABH is a very important accreditation body in India, which accredits all the hospitals, and they have these main 10 parameters. And you can see that there is only one parameter which addresses or talks about patient right and education. And believe me, most of these are left for banners in the hospital. There is no nodal officer who can manage these points of the patients. Next slide. In this very good review on survivorship care planning, I would like to read this aspect of the patients. Most of the patients and families reported unmet needs, and they experienced dissatisfaction with their healthcare providers, particularly regarding the lack of communication about prognostic uncertainty, disease progression, and education regarding treatment side effects. Very important for all of us clinicians to understand this. Next slide. So here comes the role of foundations or also patient advocacy groups. So what is a patient advocacy or a patient advocate? It's a broad range which is used for actions of any individual or any organization, such as foundations. And most of these are not for profit, and they focus on specific diseases or medical conditions or aspects of healthcare. Importantly, these foundations can act as a liaison between the patients and healthcare service providers, and thereby improve or maintain the high quality of healthcare for our patients. Next slide. The benefits are significant. They provide a helping hand for conveying the right treatment to the patients, and the patients do believe these foundations because there are no inherent conflicts involved. There is a good compliance if these foundations are involved. There is also an important value-added services for these healthcare services. And in our neuro-oncology, long-term counseling sessions are required, and these foundations can chip in and support the patients at these times. The patients take more informed decisions, they get access to new treatments and cost benefit. And I think it's a very holistic approach. Apart from the treatment, you are addressing the other important issues which affect the quality of life. Students can see this as an opportunity to pursue their career, and it importantly fills the gap which presently our public and private hospitals are not able to fulfill. Next slide. So these foundations, apart from medical assistance, wherein they help to review diagnosis, they generally have their own medical advisory boards, and the patients can send all their reports. They can also tell about the treatment options and arrange for various bedside care or act as a healthcare proxy. They also provide home health assistance, especially for our patients who can be on prolonged bed-bound or wheelchair-bound status. Financial assistance or insurance. We know it's difficult to get around the financial or insurance claims. And in India, as I'm sure in Pakistan, the health insurance sector is picking up significantly. So they can help the patients. And then in elderly and geriatric assistance, very important. Next slide. So what is the current status in our countries? Well, there is no structured patient support group. Most of the cancer foundations presently, they focus mainly on the financial part, but the patient support group activities are very minimal, or the patient counseling is very limited. Most of the patients and caregivers therefore have to manage the psychological impact of this medical condition themselves. We as neurosurgeons and neuro-oncologists do recognize the need for psychosocial support for our patients, but we ourselves are quite busy and are unable to provide for themselves. The society is slowly understanding the importance of mental health for such patients, because presently the primary focus is on treatment. But the society also needs to understand the importance of such organizations. Next slide. So what are the challenges for our patients? Well, one is the decision making. And importantly, this factor comes in. Can it be cured with medications? And can alternative medicine work, especially in our countries where alternative medicines are quite rooted in our society? Also, regarding the confidence of various facilities and whether they are getting the appropriate treatment. So they have to take all these questions into their decision making. There are also significant delays in treatment. Primarily, it could be due to delays in diagnosis because of limitations in the accessibility to the scans, but also because there is a slight lack of trust in various public sector hospitals, which are the main hospitals for the lower socioeconomic strata. Second opinions, they do take their time. And of course, Google is creating a lot of confounding variables. Patients just type and then they get bombarded with all sort of information which they are themselves unable to process. And then in lower socioeconomic strata, we need to support them with various financial schemes. And there is no structured counseling process for these patients. So these factors lead to delay in treatment. And then there is another question which generally is not addressed, and sometimes the patients feel hesitant to ask us whether they'll be competent enough to go back to the society. Will they be more prone to errors, especially in their own profession? Will they be able to expend the effort? What about if they have to get married? And then finally, the workplace support. Again, a lot of sensitization is required. Next slide. There are a lot of social limitations in our own cultures. We know that the culture of social service still needs to develop. We have a lot of culture of religious service, but the social service, especially related to mental health, still needs to be picked up. Ours is a patriarchal family system, so therefore it is taken as a sign of weakness if anyone seeks out support for mental health. This needs to change. Our patients do require frequent follow-ups, frequent investigations like MRIs, and in lower socioeconomic strata, sometimes the caregiver is, for him, the more important aspect is to run his family. And therefore, frequent follow-ups become a challenge for these patients. This career is not very attractive for younger generation, mainly because the financial remuneration is limited. And philanthropy as a culture in our society still needs to pick up. It is focused mainly on religious activities and also to some extent on providing treatment. But for the mental health aspect, it is quite limited. And when I discuss this with a lot of stakeholders, first reaction which I get across is, oh, it's a Western concept. Do you think it is required in our country? Do you think it will work in our country? So these are some of the social barriers which I come across when I discuss with various stakeholders. Next slide. Similarly, there are challenges for the clinicians. They are busy. They have long surgical hours. There is a barrier between our clinicians and the patients. Patients are quite hesitant to ask some leading questions to our patients. There are strong beliefs, and we face regularly alternate medicine patients. After surgery, they go for alternate medicine, don't go for radiation therapy, and then land up in all sort of troubles. There is quite significant amount of illiteracy, fear, and this is where we have to chip in to support our clinicians. And medical fraternity in India doesn't have any compulsion to upgrade the knowledge. So a lot of senior physicians are not able to continue or not upgraded with the latest knowledge. And therefore, when they counsel their patients, they still counsel the way that things were around 20 years back. And finally, there are no standard criteria for neuro-oncology practice. The neurosurgery is being done across all type of hospitals. And there are a lot of variations in infrastructure and faraway centers. So these are some of the challenges which clinicians face. Next slide. So as I discussed, the medical fraternity, they are themselves occupied, and we have also been trained to avoid proximity to our patients and to restrict ourselves to medical care. So somebody has to take care of these other aspects. And also, I've realized that neurosurgeons themselves sometimes are not very much sensitized about the non-medical issues which have to be taken care. And most of the times, it is looked upon as an afterthought, that once the treatment is done and patient is going through some psychological issues, now we send them to a counselor. It needs to change. Next slide. The hospitals don't see these foundations as an earning component, and therefore, and they are mainly concentrated on providing medical care, and they are unable to provide a designated space or room for such counseling services. So this is a major limitation from the hospitals. They are not sensitized to such psychological issues, and preventive mental health aspect is a very less addressed concept in our hospitals. And so these are some challenges which we face from the hospital side. Next slide. Caregivers, well, everything is focused on the patients, and therefore the concept of caregiver really doesn't exist much. And they also feel duty bound to take care of the patient. There are strong religious and social beliefs, and therefore they feel guilty if they spend some time for themselves. And therefore there are strong social pressures to focus on patient and not the caregiver. This needs to be slightly impressed upon, and I think unless the foundations or advocacy groups gather more strength, this remains unanswered. And I also feel that they themselves go through a lot of conflicting views for their patients. There is always an insecurity whether they are going for a right treatment, is there something they are missing, and they don't have a dedicated forum for such open discussions. And this is where foundations can bring across a lot of patients together, and therefore can help them address this part. Next slide. Coming to the last part, which is the limitations of the foundations. Well, the foundations are not reaching out to people. It's not easy to spread out, mainly because of availability of resource, both financial and human resource. And it's very difficult for the patients to get motivated to go for the foundations because they don't see any immediate benefit. And therefore, I feel in my own experience that these foundations have to be linked to neuro-oncology centers, so that when the patient is visiting a particular center for treatment, he gets into the system of these foundations, and both things run parallel to each other. Funding is a major issue, and as I've seen in my experience, it is across the world, but in our countries, it is much more because preventive mental health is still in a nascent stage. And therefore, coinciding with this, difficult to get a good talent or attractive talent on a long-term basis. Next slide. This was a very good review article wherein they compared the East and West. Next slide. And they finally answered that brain tumor support groups, which were created through former patients and their families, are an immense source of strength and information to the newly diagnosed patients and their caregivers. And these groups help the patients, their families, and their caregivers better navigate the cancer landscape. These groups do work to ensure that the cancer patients receive appropriate and timely care, education, financial assistance, and logistic support. And also that the brain tumor community is underserved population, which needs to have significant improvements in the care which is offered to them. Next slide. This was from the All-Can survey, and important statement, many people will say that they are coping when in reality they do need support. And if you look at these statistics, 62% did not have access to ancillary cares like physiotherapists, dietitians. 62% did have the support, but 36% did not have. And those who had, almost 88% said it was very helpful for them. Next slide. So what has been our experience? So we saw that the patients found it easier to meet the patients in the counselor in the hospitals, either in the outpatient, almost 52% when they came for initial diagnosis and treatment options. And this was very surprising. These results are based on the survey which we have done from our, and this is all in Hindi because we have just put up their survey figures or charts, and I've translated the points in English by red. And if you see, all the 100% patients were introduced to our foundation by the treating clinician. Very important. The social media, the caregivers, or the other media sources were not of much help. So clinicians have an important role to play to introduce our patients to such foundations. Next slide. What was the impact of real-time support? Well, it was easier to meet the counselor in hospital, as 80% in the blue. And these are the various parameters which helped them. 66% noted that they were able to understand the treatment-related aspects in a better way. 75% noted a significant reduction in stress and anxiety. 67% were able to handle various situations during treatment. And 22% were motivated by meeting other patients. So this is the extent of benefit the patients can have when they join such groups. Next slide. How frequently were the discussions with our counselor? To be surprised, we found when we analyzed this, almost 75% patients talk to our counselor repeatedly. 23% talk almost on a daily basis, 20% once in a week, and 30% once a month. So very important, they had someone to fall back upon. The clinician is not accessible and cannot discuss most of the daily issues. And it was here that the counselor was available for them more often. Next slide. So once they got attached or associated with the foundation, they then also joined the various the patient support group activities which we conducted. Almost 89% joined the patient support group. And how did they stay connected? By joining the monthly support group meetings, but also importantly by joining the closed WhatsApp group. Again, very significant benefit of the advancement of the digital technology. Next slide. And how did it help them by joining the support group? Again, 78% noticed there was significant reduction in stress and worry. 50% noted that they gained strength on meeting other patients. It was easier for them to manage day-to-day issues, and also they were motivated during the treatment. Next slide. So this is the benefit which we have noted. We started with the physical meet right way back in December 2019, but then switched over to the online meetings due to the COVID. Next slide. And we have been able to do it monthly, and we were surprised by how easily our patients adapted to this advances in the digital technology. And now they find it easier to join online meetings, and have requested us to have online meetings more often rather than physical meetings. Next slide. This was the first physical meeting post COVID pandemic, and many of these patients knew each other when they attended the online meeting. And when they met for the first time physically, they were so happy meeting each other, and it looked as if they were just gaining strength from each other by meeting each other. Next slide. When we see them together in one sitting together, they are at peace. We feel that they feel we are one amongst other and not the only one, and it does bring a lot of relief to their minds. Next slide. They participate very actively. This was during one of our patient-centric sessions in ISNOCON 2019, and you can see all of these patients are actively participating, presenting their views. Next slide. So finally, my last slide, how do we start? Well, the sensitization of medical fraternity is very important. And I would say that all the clinicians, especially for neuro-oncology, brain tumor, neurosurgeons and radiation oncologists, they have to lead the path. Second point is that now is the time for real-time psychological support. It should not be an afterthought. This should be started right when the diagnosis is made, because that is the time when they need our support maximum. We can start this by having interaction sessions with our own small group of patients monthly, either physically or online, and then slowly expand when we get more patients. And we need to display some of the experiences of our patients to the hospital authorities and also to the society, so that they also understand the concept of preventive mental health for our patients and also for our caregivers. Last slide, next slide, please. So I conclude my presentation with this saying from the Bhagavad Gita, that everyone has a purpose in life, a unique gift or talent to give to others. And when we blend this unique talent with service to others, we experience ecstasy and exaltation of our own spirit, which is the ultimate goal of all goals. I thank you, Komal, Brain Tumor Foundation of Pakistan, and PASNO for giving me this opportunity. I'm quite convinced that if we clinicians are able to coordinate with the foundations, it will be providing a more holistic care for our patients. Thank you so much.
Thank you so much, Dr. Nitin. This has been extremely insightful, especially the learnings you shared will be very helpful as we develop in Pakistan. Appreciate your presentation. I'd now like to invite Laura Hines, who is the Director of Operations at Brain Tumor Network. She will talk today on the concept of a patient navigator that we'd referenced earlier. Laura Hines is Director of Operations Brain Tumor Network. Prior to her role as Director of Operations, Laura worked as a nurse navigator at BTN. Laura brings with her over 20 years experience, including over 10 years at New York Presbyterian Hospital in New York City, first as a neurosurgical operating room nurse and later becoming the perioperative nurse instructor. In this role, she provided targeted training and education to nurses assigned to the surgical department to ensure excellence in patient care. Laura's son was diagnosed with a rare kidney disease at age 5, and patient navigation was not available for her family following this diagnosis. This experience inspired Laura to become a nurse navigator, ensuring that other families had access to the very services her family needed years prior. As Director of Operations at Brain Tumor Network, her role is to help carry out Brain Tumor Network's mission of guiding and empowering patients with brain tumors. I welcome you, Laura.
Thank you, Kamal, for that introduction. I also wanted to say thank you for having me here at the symposium. It's an honor to be here. And also, we're so sorry to read and hear about all the flooding that's happening in Pakistan. Okay, so as Kamal mentioned, I'm here to talk about patient navigation programs and more focusing on how we've done it ourselves at Brain Tumor Network. Next slide. I have nothing to disclose. Next slide. This is our founder, Rick Sontag. He is our president, and he set out Brain Tumor Network to provide free individualized navigation to help patients and loved ones manage a primary brain tumor diagnosis, overcome treatment obstacles, and facilitate quality access to care. Next slide. So I just wanted to talk a little bit about where the BTN story began. In June of 1994, Susan Sontag, Rick's wife, had a stroke. A short time later, she was diagnosed with a grade 3 anaplastic astrocytoma. She was told at that time she had 3 years to live. And desperate to find a course of action and treatment for Susan, he spent hours educating himself on the disease and available treatments. As several of you have already alluded to before, there was not very much out there for him to rely on as far as education for himself. He eventually got Susan into a clinical trial. This experience led them to create the Sontag Foundation in 2002 to fund brain tumor research. They chose to fund brain tumor research as their foundation's main mission, and it has since become one of the largest funders of brain tumor research in North America. In 2004, the foundation established the Northeast Florida Brain Tumor Support Group. Forever changed by their experience, they vowed to do more. And in 2014, Rick and Susan created a nonprofit organization called Brain Tumor Network to help alleviate the very stressors and barriers to care they experienced 20 years earlier. Next slide. So where are we now? Next slide. So since 2014, Brain Tumor Network has become one of the largest of its kind in North America. We now have over 15 plus paid professional staff. We've navigated over 2,000 families nationally. We've since built a customized Salesforce-based patient data electronic system. We've moved from hard paper medical records to an electronic system that helps connect the dots easier from one navigator to another. And we've also developed over 500 plus relationships with providers at institutions all across the country. Next slide, please. So patient navigation is a relatively new term, and it can mean different things to different institutions and disease sets. But primarily, it's individualized assistance offered to patients, families, and caregivers to help overcome healthcare system barriers and facilitate timely access to quality health and psychosocial care from pre-diagnosis through all the phases of the cancer experience. Next slide. So at Brain Tumor Network, one of the services that we offer that we've found is really important to the brain tumor community is offering clinical trial navigation. In the United States, as most of you know, with brain tumors, there's not a whole lot of treatment options out there. So we really have been reliant on trying to get patients into clinical trial enrollment. And there's so many different barriers to enrolling in a clinical trial. CT enrollment in the brain tumor space continues to remain very low. So we work really hard to break down the barriers that exist and facilitate enrollment in these trials. Next slide. So for patients who are seeking clinical trial assistance, we provide a personalized clinical trial search through our proprietary clinical trial matching system. Once the search is complete, we educate the patient on the results of the trial, including trial requirements and that particular design. The patient is then encouraged to share their results with the care team. And at that point, once they've discussed our results with their provider and they've decided on certain trials that they would like to explore further, we begin the process of contacting the trial site where the patient is interested in going. We really try to alleviate the gap of when the patient goes to their provider and that provider doesn't have the time to really do an in-depth clinical trial search for that patient. We try to take that time and spend that time so the provider and physician doesn't have to spend their time finding a clinical trial search or clinical trial. Next slide. Second opinions and treatment center options. Often patients come to us looking for help identifying a facility for another opinion. Based on where they're able to travel and their tumor type, we'll identify various options for them and send their medical records and imaging to the site at no cost to the patient. Another thing that we do is, and this might be something that's relevant in Pakistan, is often the patient is really uncomfortable about talking to their current provider about seeking another opinion. And that still remains a barrier today to try to empower them to talk to their provider about looking for another opinion and just bouncing off the two opinions amongst each other. Next slide. So Dr. Knighton did a really nice job of talking about social work support services, and I echo many of his sentiments on the importance of social work support services. I really can't say enough of the importance that we've realized focusing our efforts on this area. Our social work department continues to grow based on needs that come in. And often patients are not even aware that these services exist, and we let every patient know they have access to a social worker should the need arise for them. It's interesting, we still experience somewhat of the sign of weakness that Dr. Knighton had talked about a little bit and touched upon. But that barrier here is starting to really break down. Social awareness is really becoming a focal point in the United States. And I think that barrier and that willing to seek out social work support services and that emotional support connection has broken down a little bit, which we're really happy to see. And just some of the things our social work department focus on are still creating that access to care, breaking down those barriers. They help with insurance guidance, what is covered, what's not covered. Emotional support and connection is a huge one these days, especially in the post-COVID world. Financial assistance and resources, in-home care needs, and advanced care planning, including palliative and hospice. Next slide, please. Our focus is a team approach at Brain Tumor Network. We have nurses, nurse practitioners, clinical oncology social workers, and medical advisors, as well as the health information assistants. This next slide is a short video from a caregiver whose son was diagnosed with a brain tumor. It shines a light on the importance of navigation from the caregiver's perspective.
Komal, I think there's an issue with the sound. I cannot hear.
Good.
You know, it's scary when your loved one has a brain tumor. I guess there's several ways to help with that. And one of them is access to information. And with the Brain Tumor Network, access to people who've actually been there in my shoes. It was really an all hands on deck approach, and I wasn't left behind. It wasn't, yeah, we can help you, but then it was just words. It was actual physical help. Being assigned a nurse who reached out to all the different facilities where my son had medical records and request the medical records, gather the medical records, compile the medical records, review the medical records. It was just a constant back and forth information sharing. Here's what's really going on. Here's who you need to talk to. Here are the specialists, and here's how we're going to help you do that. And to me, that was really empowering to know that there was more information than what I've been given. There were people with experience with these exact kinds of problems, and they have very specialized relationships at very specialized healthcare facilities with healthcare professionals who do this day in and day out, and that just made all the difference. The Brain Tumor Network made me feel like clout, starting with a phone call. So when I called and started saying my son is being helped by the Brain Tumor Network, instead of being told I would get a return phone call, I would get almost instant access to the person I was calling. And that's the first time I noticed it. It just continued from there with the doctors who are willing to give second opinions to my son, to scheduling. We were able to ultimately get his surgery scheduled in a very short period of time. It really helped to have the Brain Tumor Network associated with my son.
Thank you, Kamal. So I really like that video, especially for this symposium, because it really touches upon the importance of also concentrating on the caregiver as well and meeting some of their needs. So what are the lessons we've learned in 6 years? Navigation can mean different things to different people. I like to use the example of a McDonald's menu. When you go to McDonald's, you know what you're going to get every single time. And high touch navigation is like a fine dining experience. The patron is very much like the patient, where the needs are individualized, and the restaurant works very hard to meet and customize those needs. we meet the patient where they're at, and we assess and do a strong clinical assessment and social work assessment to see where they're at. What are they looking for? Where are their barriers? What do they need? And then we cater our navigation services to what that patient's particular needs are. We've learned so many lessons since COVID. I won't get into all of them, but interesting, we've a little bit of a different perspective than Dr. Knighton about the in-person support group. We had to pivot to a Zoom style for support group because we had to, and it worked, and we made it work. But what we realized is that those in our support group really appreciated the in-person support group. They really liked being able to see each other. And so we're happy to announce that starting November, we are going to be reconvening our in-person support groups. And then lastly, communication. Communication continues to be a huge factor in an ongoing lesson to be learned continuously. It's finding out what particular medium works best for each and every individual patient. Is it mail? Is it text? Is it phone? Is it snail mail? In this day and age, there are so many different ways to communicate. What particular time of day works better for the patient? Do they have communication barriers due to their cognitive inabilities? So that's something that we continue to tailor and work on. And there's not a one size fits all communication design for every patient. So we had that conversation up front with the patient to really see what communication method works best for them, because we have found that it's vital to the success of their navigation experience. Next slide, please. Okay, so navigation with limited resources. I think we're talking about this in the panel in a little going to hold off on this for now. Next slide. Okay, this is just letting everyone know how we're able to be contacted. Right now, we only focus our efforts within the United States. We do hope that one day maybe we can expand internationally, but for now, to remain really up to date on all the information, there's just so much to learn out there that we like to keep our resources, and we are limited in resources, so we'd like to keep it just in the United States to what we can remain expert on. Next slide.
Thank you so much, Laura, for your presentation, and a special thanks and call out to you for joining at 5 a.m. on a Sunday morning. I appreciate it. Okay, we'll move on to our next presenter. We have Dr. Asif Loya with us, who will be talking about Pakistan's perspective on cancer support groups and hospitals' role in facilitation. Dr. Asif is currently working at Shaukat Khanum Cancer Memorial Hospital and Research Center, Lahore, as a senior consultant pathologist and medical director. He is a diplomat of the American Board of Pathology, a fellow of the International Academy of Cytology, and a fellow of the Royal College of Physicians of Edinburgh. He has 16 years post-fellowship experience at consultant level, while also managing medical affairs of the only tertiary care cancer center and one of the largest pathology laboratories in the country. There are more than 60 publications under his name, and he has authored a book and a book chapters. Also, he has served as a medical member of the Council at Pakistan Medical Commission and is currently the chair of the Board of Governors at Peshawar Institute of Cardiology in Peshawar, Khyber Pakhtunkhwa. I welcome you, Dr. Asif. Thank you.
Thank you, Komal, and the group for inviting me to talk. I was asked to talk about cancer support groups and how they exist, at least in our country. As far as I know, there is limited information with regards to cancer support groups all over the country, except for some major institutions, which include our hospital, Shaukat Khanum Cancer Hospital, and Aga Khan, and perhaps Shifa International Hospital, and some army related medical centers. So if you can move to the next slide, please. So this is the mission statement for our hospital. Just to give you a brief on what our hospital does, our motto is, our mission is to act as a model institution to alleviate the suffering of patients with cancer, irrespective of their ability to pay, and to use the most modern methods of curative and palliative therapy. We also have the mission to involve in education of healthcare professionals and also the public by various means and ways, and to also perform research to the causes and treatment of cancer. Next slide, please. So I'll come back to the hospital and what it really does, but just to give you a brief thing, we've had a lot of discussion on cancer support groups, and we all know that really is a place that gives patients and caregivers, those who've already been through treatment or those who are undergoing treatment, to share their experiences, diagnosis, their emotions with other people who are undergoing similar sufferings and similar issues. You can move to the next slide. So aims of cancer support groups really is to help people cope with all the emotional aspects that are associated with the cancer, its diagnosis, and its associated treatment. It also allows for people to learn from each other, and especially those who are facing similar situations. So really focused support groups, specialty-wise and cancer-wise, it really helps in that way. Patients really get encouragement and optimism to live life with hope and inspiration. And they discuss various ways of how to cope with various issues associated with the treatment and diagnosis, and they exchange information and find effective ways of coping with the disease that they're currently suffering from. Next, please. So talking a bit about our hospital. So this is a 195-bed tertiary care cancer center, state-of-the-art, with most modern diagnostic treatment facility. And in addition to that, we have a palliative service available as well. It's part of Shaukat Khanum Memorial Trust, the charitable institute, which was inaugurated in 1994 in December. In addition to that, since 2015, we have another hospital that's part of the network now, that's in Peshawar. And then there's another hospital which is currently under construction in Karachi, and it's expected to come online by December 2023. And what really got the hospital going was Mr. Imran Khan, who's a famous cricketer, as well as the past Prime Minister of this country. He got the inspiration to build the cancer hospital after his mother, Mrs. Shaukat Khanum. He succumbed to cancer in 1985. And what he realized during his mother's illness is that he witnessed the plight of all these poor cancer patients in Pakistan who had no real place to go for treatment. He realized the need for a specialized cancer care center in Pakistan. He could afford to take his mother to UK for treatment, but he realized that so many other people were there who could not do that. And that really led to the idea and to the development of this state-of-the-art cancer center. Just to brief a bit about how we really go about it, we have about 75% of our patients who are currently in the system are treated completely free of charge. That includes everything from diagnosis to treatment, to surgeries, to palliation, to everything, and the follow-ups for cancer. Everything is done free of charge. And then the rest, 25%, some of them are on partial support, like, some of them would pay 50 or 60 or 70%, or even 20, 30%, and the rest is paid by the hospital. And then there are these private patients who can really afford the treatment and have the means and ways of doing that and affording the treatments. Next slide, please. So this is the history of this hospital, 1985, when this lady, Begum Shaukat Khanum, the one highlighted in the center under the red circle, she succumbed to cancer, and the boy besides her to the left of your screen is Mr. Imran Khan. He decided to build a cancer hospital in Pakistan in 1989. He started a worldwide fundraising campaign that started in 1989. In 1991, he started the construction of the hospital. And in 1992, Pakistan won the World Cup cricket. And that really was a big boost for him to collect the funds. He went on streets, to schools, to various people, to various countries, and everybody really helped him. And in 1994, it was eventually inaugurated by the first cancer patient of this hospital. So this was another thing that instead of a VIP or a president or a prime minister inaugurating this hospital, the first cancer patient inaugurated this hospital, and she still survives and is currently living in Lahore. Next, please. So cancer stats for Shaukat Khanum Cancer Hospital, and this really is coming from our cancer registry and the Clinical Data Management Office. We also contribute to Punjab Cancer Registry. Punjab is the province where Lahore is located, and as you can see, breast is the most common cancer, just like it is worldwide, followed by colorectal, then leukemias, lip and oral cavity cancers, non-Hodgkin's lymphoma, and then Hodgkin's lymphoma, and so forth. We also have this data going into WHO's IARC database, and this is updated every year as part of Punjab Cancer Registry and all the contributing hospitals that contribute their data into our registry. The data registry is now also extended to KPK province, and there is also a data registry existing in Pakistan with support from Aga Khan University Hospital as well. Next, please. So cancer support groups that exist currently at Shaukat Khanum Cancer Hospital in Lahore as well as in Peshawar are these ones on your screen. The breast cancer support group, obviously the most common cancer worldwide as well as in the in this country, in Pakistan. And then we have the stoma support group related to the colorectal tumors and other GI-related tumors, amputee support group, pediatric support group, all basically taking care of all the pediatric cancer patients and their parents or their caregivers, head and neck support group, palliative support group, and then we have a bereavement support group. So let's talk a little bit about each of them moving forward. Next slide, please. So breast cancer, as you know, the most common cancer that occurs in women, really challenges their sense of identity, interfere with the role, it causes low self-esteem, body image issues start occurring. So this was really the first group that we started, and this was led by a psychologist, and we have a breast care nurse. And then in addition to that, breast cancer survivors are also part of this group. A meeting is held every week where various issues related to the treatment, diagnosis, to emotional issues, and moving on as they follow up into the system are discussed, and they are sorted for them if it can be, or they're given as much help as possible, both psychologically as well as emotionally. And in addition to that, they are continued to be followed up in the system. Next, please. Stoma support group. Stoma, mainly related to the GI-related tumors, obviously have significant emotional disturbance for the patients. There's a risk of leakage, occupational difficulties happen. You have to really take care of it and make sure that you change it on time. The quality of life really is affected a lot. Body image issues start appearing. So we have a stoma care nurse on board, and this is really led by this nurse, and we also have the psychologist, the nutritionist, obviously very helpful with regards to the GI tumors and its effect on the nutrition, and then the cancer survivors are also part of this group. And again, this meeting is held every week to support these patients and those who are currently in the system under treatment. Next, please. Then we have the amputee support group. Inability to support self, and one really feels like a burden to the family or whoever is taking care of them and their friends and family, because everyone starts offering help, and really causes significant psychiatric disturbances, and including depression among some of these patients. This is again led by a psychologist. We also have physiotherapists in this group to help them cope with various issues of amputation and recovery following that. And other cancer survivors are also part of this group, in addition to a nurse practitioner. And the meeting is for these patients, since the numbers are not that as many as for the previous ones that I discussed. The meeting is held once a month, depending on the number of patients and the survivors who really want to be part of this group. Next, please. So pediatric tumors, every year we have about 500 to 600 pediatric patients who undergo treatment for cancer, and for various cancers, mainly leukemias. And it's really devastating for children and their parents. The adjustments and the reactions and the patient's acceptance, in addition to parents' acceptance, is really an issue and interferes with the treatment process. So once they are into treatment, they really are made part of this group where there's a psychologist, there's a physiotherapist, there's a nutritionist, the parents are there, and there's a play therapist there as well. And all other cancer survivors are there as part of the group. We also have, just to update on that, we also have a primary school system that we run for these patients that starts from anywhere from the basic education to class 1 until class 4th. And they go through the normal syllabus that they would actually go through in any school. They undergo graduation ceremony. We make sure that they move from one class to the other while they are under treatment and under follow-up, and those who can't really go to the school for various reasons. So that really helps them, with their education needs as well, so that while they're under treatment for cancer, they don't just continue to go down, and their parents don't feel that they can't even go to school and all. So we offer that service to these cancer patients as well. And the meeting for the support group is held once a month for these patients and their parents. Next, please. So head and neck tumors can really lead to a lot of morbidity, disfigurement of the face, loss of functions, complex pain-related issues, social stigmas, shame and guilt, a lot of issues that occur, nutritional problems. So this is, again, something that is held once a month, this meeting, and deals with these head and neck cancer patients. There are a lot of these patients who actually come from the province of Khyber Pakhtunkhwa, as well as from Sindh, and we're expecting a lot of them coming to our Karachi hospital once it starts functioning. And this is really related to having all these, the betel nuts and the pan and the gutkas and all those kind of meanness that are there in our society, and that really leads to these mouth and oral cavity cancers and the tongue cancers. And the treatment then leads to many issues. And so we've had the support group running, and it really meets every month and helps them cope with all these issues of disfigurement and pain and all. We also have a pain clinic and pain service running for these patients and for other patients of cancer as well. So that patients who are unable to bear pain, we have a specialist who actually deals with, who has done a fellowship from Harvard, mainly in head and neck pain. So that just goes to show that how important it is to manage pain in these patients of head and neck cancers. Next, please. So palliation, really a major issue once you're at a stage when you know that you're really at a support stage where you need comfort measures, psychosocial support, your symptom management, pain management, and you need to really focus on that you have some time to live. Your family is suffering. You need to have your goals straightened out. Your family needs a lot of support. So we have this support group for our palliative patients, and they really help with the symptomatic management of patients who are suffering from advanced cancers. Can be very distressing, especially accepting that they're now at the last stage of their cancer, and they still keep thinking that hope is still there for a cure. But obviously, passing on the information to them and helping them cope with that reality is something that is very important, and that's why we've established this group. We have a huge and very active palliative care team available We have fellowships going on where trainees are actually doing fellowship in this palliative medicine. This has recently been approved by the College of Physicians in Pakistan as a formal fellowship. So it's mainly focused on patients, families, as really the fear of losing the loved one and uncertainty of future makes them feel helpless. In addition to the patients, obviously, this is led by a psychologist. Patients, family, and volunteers are part of the groups, and this meeting is again held every month to help them cope with all these challenges that they are going through, especially the family. Next, please. So before we with all these groups, we also have the bereavement support group, and as you must know all that there are 5 stages of grief, and all those are the denial, the anger, the bargaining, the depression, and then acceptance. And really, that is something that we all have to face one day, but everybody expresses it in a different way, the grief in a different way. It could be directed to the immediate family, to the children, to parents. It could be directed to anyone. It really, the families who are going through grief, the loved ones have died from cancer, they really need help. And this is where the bereavement support group comes in, and this is led again by psychologists, and the palliative care team is there. Volunteers are part of this group as well, and this meeting is held quarterly to support them of any needs that they have with regards to emotional trauma that they are going through second to the death of their loved one. So with all these groups running, we were obviously approached by Mrs. Komal, and we were asked that if we would be interested in having a support group for the CNS tumor patients. We have quite a few of these patients who are undergoing treatment at our facility. And this is something that we're currently working on with the Brain Tumor Foundation of Pakistan. And we're in the process of signing off an MOU and perhaps getting help with this network, so that all the facilities that they have available with regards to various things that they discussed in their talk initially at the first talk, we could get help from them, and perhaps whatever we are running right now, we could have a betterment of that when we start that CNS tumor group. So something that is currently in the pipelines, and we hopefully plan to have that early next year, inshallah, if all things go well, and this is what the plan is. In addition to that, all these support groups, if there is a patient that requires any kind of support, which is really urgent, and the physician feels that that can't wait, then they can always be directed immediately to a psychologist's clinic, which are happening every day. We also have, for all the cancer patients who are on follow-up, we have a distress score scale that is checked for each patient who is on follow-up in various cancer clinics. And if that distress scale, which is part of a pathway as well, identifies that the patient is scoring more than 7 on that scale, then the real issue, which could be emotional, which could be financial, which could be anything that that patient is feeling, they are directed to the relevant department where they could get help, and then they're followed up again within 8 weeks' time to see if that issue that was identified on that scale was resolved or not. So this is another something that we have in place for quite some time now, and something that we've been doing for our cancer patients. So next, please. So what about physicians who deal with cancer, its morbidity and mortality, and on daily basis? So we have a burnout support group for physicians as well, and that is available throughout the year. It meets every quarter, but in addition to that, information is passed on to the physicians continuously that if you need help, you can always go and get yourself and talk to a psychologist who's available to support you. In addition to that, we also offer second victim counseling for our physicians. So anyone who's part of a sentinel event or anything that is related to something unfortunate to the patient, even though it could be the fault of a clinician or a care or a nurse or whoever is taking care of the patient, but it does not mean that they don't go through the issues, and the psychological counseling is a must for them, and is offered to them if they want to opt for it. So next, please. So burnout really is a form of exhaustion which can be caused by constantly feeling swamped, excessive and prolonged emotional, physical, and mental stress. Burnout is really related to one's job in many cases. And it happens when you're overwhelmed, emotionally drained, and unable to keep up with the demands that a life throws towards you. Next, please. So many signs of burnout are there. Obviously, emotional, where you feel anxiety or depression, you feel anger, there's chronic stress. There could be mental issues, you start forgetting, you feel hopeless. There's lack of interest or motivation. Then there are physical issues where you feel exhausted, your appetite goes, frequent health problems start occurring, you can't sleep properly. So all these really issues are something that we also keep passing on to our healthcare providers or our physicians as part of the CMEs, which our psychologists ensure and give some time in our weekly CME programs. Next, please. So really, burnout. We tell them that you need to have a balanced diet, keep exercise as your goal, some exercise every day. Practice good sleep habits, and always ask for help if you need, and if you are going through all the signs that I just highlighted, and that is something that is passed on to them as part of the information that is given out as part of the CME talks to the healthcare providers. Next, please. So burnout support group directed towards physician. It is led by psychologists, and they meet quarterly. But again, like I said, they're offered and they're asked that if they need help at any time, they can always opt in and go to a psychologist, and there is no bar on that as such. Next, please. So as far as the administration and the role of the hospital administrator, really making sure that the cancer support groups are created according to the statistics. And this is something that I showed you, all the support groups that we have, and this really ties in with the number of cancer patients that we have in each group. Providing support for all the support group meetings, making sure all the relevant people are available, all the nursing representatives, psychologists are available. Encouraging the healthcare workers to participate in these support group activities. Like I said, we have these CME activities going on where we tell them the signs of mental, emotional signs of burnout, and all the support that is available to them. Spreading awareness about support groups, and again, this is done through CMEs and emails and information, and even the screensavers that we have that also keep giving out this information. For the patients, there's information given out about the existence of these support groups, and we encourage them to be a part of these activities to help them cope through those issues and the emotional trauma. Education and training opportunities for our caregivers, especially those who are part of the support groups. And in addition to that, our trainees, as part of their induction program, we make sure that we give them at least a 2 or 3 hours communication skills workshop, so that they know how to give the correct information and break the information to the patients who are diagnosed with cancers. Infrastructure development, obviously, and maintaining and creating the cancer registries. Like I said, we have the Punjab Cancer Registry, which has been there for more than 15 years now. It's also giving out data to IARC, the WHO, and we just started cancer registry in KPK province, as well as there is a cancer registry in Sindh. Then as far as the cancer screening programs, we have the breast cancer screening programs as one-stop breast clinics are available. We also make sure that we keep giving out awareness sessions and awareness campaigns, especially with regards to breast cancer, anti-smoking campaigns. We also participate in the World Cancer Day. Cervical cancer screening programs are available. We also support research as far as, and that's also part of our mission statement. We have a whole research wing where we have a basic science lab, we have a research office. A research fund is available for them to help them with the research projects that they are doing. In addition to that, clinical research is going on, and the research office really helps out with all the nitty-gritties of that, including getting the relevant approvals from the IRB. We have a IRB chair who's a non-Shaukat Khanum employee. So all the good practices and ethical practices are followed when doing any kind of research in the hospital, and a lot of emphasis is given on that. It's also part of physicians' appraisal process that they must be involved in at least some research activity. So all these are really part of something that hospital administrator must ensure, and this is something that is currently being ensured in our hospital, and we continue to aim and hope to do better and more, and hopefully we will have more and more of the institutions in our country adopt to this, in addition to the ones that are currently involved in this. Next, please. All right, so I think I'm going to go to the panel discussion, so we can have the questions then. But thank you very much for inviting me, and appreciate the invitation, and thank you, Ms. Komal, for all the good work that you're doing.
Thank you very much, Dr. Asif, for sharing all of this. I think we're looking forward to signing the MOU with you, and hopefully being able to collaborate and partner more with Shaukat Khanum Memorial Hospital. One of the things you mentioned is we hope that we'll be able to improve. There's this saying that comes to mind. It says, good intentions never work. You need to have good mechanisms to make anything happen. And I think the work that we're doing, all of us together, is really to strive to have those mechanisms in place so that it's not just our intentions that drive us. Thank you. Okay, let's move on to our next presenter. We have Shannon Lahaye, who is CEO of Brain Tumor Foundation of Canada. Shannon will talk about achieving scale through awareness and support. Shannon Lahaye, MPLN CFRE, is the Chief Executive Officer at the Brain Tumor Foundation of Canada, whose mission is to reach every person in Canada who is affected by a brain tumor through advocacy, research, information, support, and education, with the ultimate vision of finding the cause of and cure for brain tumors while improving the quality of life for those affected. The Brain Tumor Foundation of Canada has been established and has been around for 40 years. So it puts them in prime position to talk about this topic. Shannon's experience in the nonprofit sector has focused on healthcare and community-oriented areas aimed at improving health and well-being, with a focus on eliminating barriers to equitable access, treatment, and opportunities. Shannon's commitment to the nonprofit sector extends beyond her career to her involvement as a volunteer leader with the Association for Fundraising Professionals and several charitable organizations close to her heart. I welcome you, Shannon. Thank you.
Thank you, Kamal. Good afternoon, everyone, and thank you for inviting me here today to speak with you about our foundation and how our experience may be able to help the Brain Tumor Foundation of Pakistan achieve its mission and vision, which are so closely aligned with ours and which I believe we're all here to support today. Brain Tumor Foundation of Canada is celebrating its 40th anniversary this year, as Kamal said. It's an accomplishment that we're incredibly proud of. Through a great deal of work and support, we've continued to grow and to expand the support that we're able to offer the brain tumor community. And though we've seen incredible achievements in our 40 years, unfortunately, our work is not yet done. As with any charitable organization, we're driven by our mission, vision, and values, and advocacy, research, information, support, and education, what we term as ARISE, really are the pillars of Brain Tumor Foundation of Canada and what we do. Like so many foundations, our origins come from a personal story. Brain Tumor Foundation of Canada exists because of 8-year-old Kelly Northey. In 1981, Kelly was diagnosed with a brain tumor and only 6 months later, she passed away. Unfortunately, at that time, there was little organized support for Kelly and her family, and very little research into brain tumors was being conducted. Following Kelly's death, her father, Steve, her neurosurgeon, Dr. Del Maestro, and his wife, Pam, who was also a neuroscience nurse, sat around Steve's kitchen table in London, Ontario, discussing how they could help other families going through the same ordeal. Specifically, they were looking to offer support and credible resources. 40 years later, Brain Tumor Foundation of Canada is a national organization with many relationships internationally as well, obviously, as evidenced by this opportunity to share with you today. Our co-founders are still very much involved with BTFC as funders, fundraisers, and advocates, continuing to raise awareness. That initial conversation about the need for a resource and credible information resulted in our 4 handbooks. We offer an adult, pediatric, non-malignant, and caregivers handbook. These resources are all available in hard copy at no cost. So patients, caregivers, and healthcare professionals reach out to us and request copies, and we send them out at no cost. A little later, I will share an exciting new way to access these handbooks as well. Next slide, please, Kamal. So I'll start with a brief overview of what we do at BTFC and then provide a little more detail as we go. One of the things that makes us unique is that we support those affected by both malignant and non-malignant brain tumors. At BTFC, we don't use the word benign when referring to brain tumors, as we don't believe there's anything benign about something growing in your control center. Any brain tumor is life-changing, regardless of grade or stage. In addition to the handbooks, we develop and provide many other resources and programs for the brain tumor community. We collaborate with the healthcare professionals who work so closely with patients, survivors, and caregivers. We fund relevant and innovative research projects to find the cause of and a cure for brain tumors, to advance treatment options, to improve quality of life for those affected by brain tumors. And we're able to do this because of our dedicated team of staff and volunteers across the country who help raise awareness and the funding that we need to do our work. I'd like to provide you with just a few highlights of some of our accomplishments that I believe better demonstrate the work that we do. The nearly $10 million we have raised for research funding is distributed through several grant opportunities, from $5,000 youth education awards for kids going off to post-secondary to $100,000 fellowships for researchers to advance their work, as well as ensuring succession in the field of neuroscience and neuro-oncology. We also collaborate with other funders to offer additional grants internationally. BTFC is also the sole funder of the first brain tumor tissue bank in Canada, located in London, Ontario, which provides free samples to clinical researchers around the world to further the search for a cure. In 2019, we launched the National Brain Tumor Registry of Canada. This is a first of its kind registry, providing exclusively Canadian data on both malignant and non-malignant tumors to better understand prevalence and survival rates for brain tumors and to get a better picture of who is affected and the possible causes. The newest report, the 2021 Incidence and Mortality Report, is the most thorough report of its kind in Canada. One of our most recent advocacy efforts has resulted in the delay of a discontinuation in Canada of a key chemotherapy drug. Initially planned to be discontinued in June 2023, the current manufacturer has agreed to delay that until March 2025, so almost an additional 2 years, as we continue conversations about a long-term solution for patients. Next slide, please. So here are some of the programs, services, and resources that we offer the brain tumor community. As has been talked about in some of the other presentations, since the beginning of the pandemic, we have paused our in-person support groups. However, we've been able to expand our outreach to our community through virtual and Facebook support groups, which include separate groups for patients, caregivers, young adults, and pediatrics, with our adult and pediatric groups offered in both French and English, our 2 official languages. These are non-medical support groups that provide a safe space to share questions, difficulties, worries, and celebrations to help bring a sense of meaning, purpose, or understanding to the experiences of our community. As many of you know, more children die each year from brain tumors than any other childhood cancer. And as we work to find a cure, we must also support these children and families through their diagnoses. We offer a number of pediatric focused supports and resources, including a storybook, a coloring book, sibling support services, a brainwave program, which is a program that provides fun family events and activities, and Super Kids, which is a teaching resource and a fundraising tool for kids. Our webinar series is intended to bring hope and information through a variety of presentation topics, including treatment options, mental health, research, legacy giving, caregiver support. And our website is a critical tool for providing our community with links to key resources, contacts, news and information, and detailing all of the programs and services that we offer. So I alluded earlier to a new way to access our handbooks. And this year we launched a first of its kind app that serves as a new way for members of the brain tumor community to connect and access support and resources. This means that the handbooks are now available on your phone or tablet, either as a PDF or as an accessible version, where you can increase the size of the text or highlight text, make notes, skip ahead. You can even share key points of the text with others. In the coming months, we will also be offering a peer-to-peer support function through the app. So that's a little about how we started and the work that we do now. But how did we get here? What have we done to grow from a kitchen table conversation to a national charity? And more importantly, how have we achieved financial stability and sustainability? Funding is the ultimate answer, but securing funding can be a challenging process, and you have to start somewhere. Next slide, please. So I'd like to start by clarifying two terms, fundraising and fund development. Fund development is the process of creating and cultivating relationships to ensure current and future funding. I believe that part of that definition is important enough to repeat. It's creating and cultivating relationships. Fundraising, on the other hand, is really only about income generation. So there is a place for both of these in the establishment and growth of a charitable organization, but lasting stability and sustainability are achieved through the development of relationships, not just by raising money. Because funding is often limited in the beginning, building relationships and partnerships is key. People are your primary resource. These people are generally all likely to have a vested interest in the foundation and the brain tumor community. And so building a board of directors from varied professions and sectors provides a breadth of experience and expertise, which will advance the work and expand the reach and network of the foundation. Volunteers are the backbone of a charity, not just in the early stages, and there is so much work to be done, and funding for staff is always limited. Healthcare professionals and researchers are obvious partners for a brain tumor foundation, as your work is supporting the same community. And the brain tumor community itself, patients, survivors, caregivers, family and friends, they can be a significant resource for growing a foundation. Being able to share personal stories and connect with others is incredibly impactful and cultivates meaningful relationships. Lastly, I would say identifying alignment creates a starting point for the conversations that can lead to partnerships. For instance, one of our key funders is a critical supplier of medical isotopes globally. So it's an obvious alignment between our organizations, and therefore our relationship really is mutually beneficial. Next slide, please. So these tend to be the most common fundraising opportunities for charities. These are fundraising, not fund development, because they are solely about raising money and rarely about building relationships with the foundation. I won't spend too much time here because I think most of us are familiar with this concept, and this work is largely driven by the charity. But there are some aspects of fundraising that you can help with. Participation and raising awareness are key to most fundraising activities. With respect to tribute giving specifically, patients and caregivers often seek the advice of their physicians and other healthcare professionals when making decisions about where to direct donations or in their own legacy giving after they pass away. So being aware of the work of the Brain Tumor Foundation of Pakistan And being able to offer this as an option to patients who ask is another way that you can support the foundation. Funding from grants is not easy to secure. Two main challenges faced by charities are identifying appropriate grants for which they may qualify and having the expertise or the knowledge to complete the grant applications. So healthcare professionals are often working in an environment where these funding opportunities are more widely known. So I would invite you to share those opportunities with the foundation, and where you're able, share your expertise in completing the application process. Next slide, please. So I've shared many of the things the Brain Tumor Foundation of Canada offers to patients, survivors, caregivers, and healthcare professionals across Canada. I believe that the Brain Tumor Foundation of Pakistan can provide similar awareness, support and access to credible resources, and funding for research and treatment to patients, survivors, caregivers, and healthcare professionals across Pakistan. But they need your support to do it. So here's what you can do. Volunteer your time and expertise. You can do this by joining the board of directors or a committee, by speaking at an event, or by helping to produce information and resources to share with the brain tumor community. Each of you has a network of colleagues, friends, and family, many of whom may have connections to the brain tumor community that you may not be aware of. So share information and spread awareness about Brain Tumor Foundation of Pakistan. Facilitate introductions between people and organizations in your network and Brain Tumor Foundation of Pakistan to help the foundation create and cultivate the key relationships that I mentioned earlier, which can lead to funding opportunities and to growth, stability, and sustainability. Connecting your patients to Brain Tumor Foundation of Pakistan is beneficial for both the patients and their caregivers and the foundation. The foundation is there to support patients and caregivers through support groups, access to credible information and resources. But patients and caregivers are also often looking for a way to make a difference for others, just as our founders were when they started Brain Tumor Foundation of Canada. So giving a financial gift to the foundation is a demonstration of gratitude and is often considered to be part of the healing process for patients and caregivers. And of course, you can provide the foundation with a financial gift that demonstrates your commitment to supporting the brain tumor community in Pakistan. You have the ability to affect meaningful change by supporting the Brain Tumor Foundation of Pakistan and the brain tumor community. So I'd like to thank you for your time today, for having me here, and for all that you are doing to support the brain tumor community. I invite you to follow us on social media, visit our website, sign up for our newsletter, or reach out if you have any questions, because it is important to us that we expand the survival and the network for our brain tumor community, not just in Canada where we operate, but across the world. Thank you.
Thank you very much, Shannon. This has been super helpful. And the concept you mentioned of fund development is exactly the phase we are in right now. And to be honest, we haven't, and we've consciously not started fundraising, yet, because we wanted to focus on developing and cultivating those relationships and making sure we have, services offered before we go out into the community to raise funds. So I appreciate all the support from your end. Okay, so we'll move on to our next and final presentation before the panel discussion starts. This topic is on what is survivorship. Our presenter is Naomi Hofer. I'll mention that Naomi, it's about, I think, 3:30 a.m. at her place right now, so this presentation is pre-recorded, but I'll do an intro nevertheless. Naomi Hofer, MA, MCHES, holds a master's degree in integral health education and is a master's level certified health education specialist. She is the program manager for the Neuro-Oncology department at the University of California, San Francisco, UCSF, where she has worked alongside clinical staff over the past 4 years to develop the Sherry Sobrato Bryson Brain Cancer Survivorship Program. Before joining the Neuro-Oncology department, she worked for UCSF's Comprehensive Cancer Center for 16 years, where she created hundreds of programs and events designed to support and educate patients and families living with a cancer. She is also a certified cancer journey coach and works with individuals and groups to support patients' well-being during cancer treatment and throughout survivorship. She's passionate about advancing health and healing through incorporating wellness-focused programming throughout clinical systems. I'll start her presentation now.
Well, hello, everyone. My name is Naomi Hoffer, and I'm the program manager for the Sherry Sobrato-Brisson Brain Cancer Survivorship Program. And I have the privilege of working for the University of California, San Francisco Brain Tumor Center. I'd like to thank the Pakistan Society of Neuro-Oncology for the invitation and opportunity to share with you the work that we've done at UCSF in this talk titled From Surviving to Thriving, a model for a holistic neuro-oncology survivorship program. Before I proceed, I'd like to take a moment and acknowledge our generous donor, Sherry Sobrato-Brisson. The program is named after her, and we are forever grateful for her financial support and partnership. I also wish to express my deep gratitude to Dr. Suzanne Chang for her outstanding leadership and vision, and who I work with very closely, as well as to the many talented and hardworking members of the survivorship team who are instrumental in allowing our program to operate and further develop. While survivorship efforts are now well established in other cancer types, we are just beginning to address issues of survivorship in our brain tumor community, as patients are now living longer with their diagnosis thanks to medical advancements. We know brain cancer patients represent a unique population with distinct and complex physical, emotional, cognitive, and psychosocial needs, which are often unmet by general cancer resources and services. Compared to other cancer types, brain cancer patients report higher symptom burden and distress when it comes to managing and coping with their side effects and navigating their medical and rehabilitation care. Family members are affected as they fill in to compensate for their loved ones' limitations. And brain tumor patients are more likely than any other cancer type to be under or unemployed due to their illness. So with a generous donation from Sherry Sobrato-Brisson, we set out to develop a program that would address the unique needs of our survivors. We developed a mission statement, as you see here, and we started with some questions to guide us. What is the survivor experience like outside of the clinic? What does it mean to live a great life with brain cancer? And how can we support our patients in doing so? So we began by learning from the experts, the survivors themselves, through individual interviews and focus groups. While no brain cancer survivor experience is exactly alike, there were some common themes and perspectives that frequently came out. Some of the things we heard are highlighted on this slide. We saw somewhat of a dichotomy existing within individuals. On the one hand, they were lost and struggling to cope, but on the other hand, they were deeply grateful and wanting to live their best lives, and several even indicated a strong desire to give back and help others. We looked for a way that our program could support our survivor community on either end of the spectrum. So we see our program as somewhat of a bridge that assists survivors who may be feeling lost and disconnected to having a sense of feeling more empowered. We recognize, however, that this is not necessarily a one-way street. And whether our patients identify as survivors or thrivers, we want to support them in living their best life. We do this through 7 pillars of support. The first pillar that we prioritized was cognitive care and the development of an integrative cognitive care clinic embedded within our neuro-oncology department. As we know from the literature and from our assessments with patients, this is one of the most distressing effects of brain cancer and treatment, the disruption in one's own thinking ability. And our team has now documented the positive effects that cognitive rehabilitation has on patients' quality of life. With initial donor funds, we were able to hire 2 part-time neuropsychologists and a half-time health psychologist who can all bill for their time. The team approaches their consultation and management from a personalized, holistic, strength-based perspective, focusing on the needs and goals of the patient. Once referred by their neuro-oncologist, patients are given a full battery of tests for cognitive evaluation, followed by cognitive rehabilitation using compensatory strategies. The team also helps with care navigation and disability advocacy and support. Education for both the patient and their care partners helps normalize the experience of cognitive changes and can bridge understanding among family members. Additionally, the team helps the families connect with local community resources, recommends and places referrals to our in-house health psychologists or psychiatry when warranted, and can assist with school and workplace accommodation requests. The second pillar that we knew we wanted to build out was an emphasis on creating or maintaining physical activity. We know that exercise is beneficial in many ways, and studies specific to the brain tumor population are now being done that support these efforts. We developed the Workout for Wellness program. Again, with the support of donor funds, we hired an exercise physiologist to support our patients through one-on-one consultation and group programming. We also hired one of our survivors, who is a yoga instructor herself, to offer virtual yoga class instruction, and this has been very well received by our patients. We have established a relationship with our campus fitness center to offer short-term passes that include 4 sessions with a personal trainer. And to help support and empower patients to exercise on their own, we've created over 100 short exercise demonstration videos and are currently working on categorizing these videos and uploading to our website. Access to credible health information is important to feeling empowered in one's health behaviors. While much information is imparted by healthcare professionals during the appointment, this information may not be retained. Additionally, a barrier that we often hear from brain cancer survivors is that searching the web can be frightening and depressing. Thus, we felt it was important to find ways to provide accessible, easily digestible, wellness-focused information that speaks directly to our brain cancer thriver population. We do this in a number of different ways. Our Living Well webinar series is a regular offering that includes a survivor voice whenever possible, in addition to the professional experts. We always begin with a 3-minute grounding meditation to help viewers switch gears, relax, and enter a learner's mindset. After our presentation, we invite viewers to stick around after the show, where we stop the recording and allow them to turn on their videos to meet one another for a face-to-face discussion on the topic and to help integrate the material. We house these recordings of webinars in our growing video library. Topics are varied, but all focus on wellness promotion and empowering strategies for living with brain cancer. We have recordings related to social wellness, physical wellness, cognitive wellness, and emotional wellness. We're also able to quickly pull together webinars on special topics that trend in our population. We've done several COVID updates now and have also presented on cannabis and psilocybin, which have gained more interest in recent months. In addition to our video library, we have created single-issue information sheets on a variety of topics such as these, and we continue to develop more as needed. A patient education advisory committee was formed to help us edit these sheets and make sure that they are written from a patient-centered perspective. We have also recently created a cognitive strategies booklet, which is soon to be printed as well as available online. We know that the functional and cognitive changes of this illness can have significant impact on social behaviors. Survivors can easily become isolated, especially if they have language impairment, are unable to work, or unable to drive. We also know that social connections play a large role in perceived wellness and quality of life. Therefore, one of our goals was to create opportunities for social engagement among patients whenever possible. As we set out to create community among our survivors, we first created our messaging through a newsletter we call Thriver News. Thriver News offers inspiring perspectives and informs readers about events and program offerings specific to the brain tumor population. Because we needed patients to opt in to receive these newsletters, we first created a patient list in our medical record database, including patients with stable disease, as well as any patient identified by a provider who may be interested in wellness activities or community connection. We sent a secure message and invited them to join our Thriver community by signing up to receive our monthly Thriver newsletter. And we use this as a vehicle to tell them about our monthly support group, which is open to anyone living with brain cancer as well as caregivers, and our Survivors Peer Support Program, inviting people who wanted to volunteer to do so. For everyone who completed the training and signed the privacy and confidentiality agreements, they were then invited to join our Thrivers weekly meetup group. This is a special group where we really see community connection happening right before our very eyes. We give them chances to have direct online conversations with each other, individually and in groups. We also teach additional tools for supporting each other and applying it to one's own life. Many close relationships have developed, and because we meet weekly, we have started using the term family to describe this group. Having them all sign the confidentiality agreements allowed for more free-flowing communications between participants, and often outside of our weekly meetings. Mentioned earlier, our webinars include a community connection component, and we also look for opportunities in group classes to allow participants to have both structured and unstructured conversation. We find that the unstructured conversations are especially valuable in this population. One widespread and growing area of interest to our survivors is learning about complementary or integrative practices that they can easily adopt to promote their health and increase their longevity. Upwards of 30% of patients with glioma use integrative therapies in addition to their standard of care therapy, and depending upon the scope of the definition, it may be as high as 80% in some populations. While there is some evidence suggesting benefit, there is also much confusion about which therapies show evidence-based promise for relief of symptoms or prolonged survival. What is more, most patients do not report their use of integrative therapies to their oncologists, which could be cause for concern where contraindication is warranted. So with the help of integrative oncologist Dr. Donald Abrams, we created a 3-part class series addressing evidence-based nutrition and integrative medicine recommendations for our brain tumor population. This class covers dietary recommendations, plant therapies, including cannabis, and other non-conventional interventions for helping support patients' overall health, improve cognition, and alleviate side effects such as pain and fatigue. We offer this class twice a year in small group format. Each includes individual consultation with the integrative oncologist, as well as a group goal-setting discussion. With all the emotions and distress caused by living with brain cancer, it is important to provide individual support. While access to mental health professionals is essential, and we do refer regularly, survivors tell us that the experience of brain surgery and treatment and diagnosis is something no one can truly understand unless they have experienced it themselves. Peer support programs are a way to offer patients informal support by someone who truly gets it. We created an in-house peer support program that we adapted from our cancer center's general peer program, and we trained our volunteers to listen with empathy, share their own experiences without offering medical advice, and to keep these conversations confidential. Brain cancer patients can request support at any time by simply completing an online request form. We then match as best as we can on the various factors indicated. Connections can be single, meaningful phone conversations, but many continue the relationship, and several have developed long-term friendships. Our last pillar is actually the one that I find the most important and which often gets overlooked in supportive care programming efforts. Survivors of brain cancer are now thankfully living long lives with their disease. Yet what does that mean to live a long life with a terminal diagnosis and with cognitive and functional changes that alter one's ability to assume the same roles and contributions in life? What might this do to one's sense of purpose and meaning? And how might that affect one's physical and emotional health? While professionals and others want to help our patients and have good intentions, we often overlook that our patients need opportunities to make valuable contributions in their lives. We knew that tapping into our patients' experience and perspective could lead to a win-win-win for the patients, the community, and the program itself. From the beginning, we listened to our patients in the design of our program, and we continue to learn and be guided by them through evaluations and simply hearing the perspectives, ideas, and concerns that they bring up in discussions and in groups. As we've outlined, our program relies heavily on the involvement of our survivors. We invite them to be on our advisory committees and webinar panels, and we depend upon them to provide support to others in our peer support program. We have peer volunteers who lead young adult support groups, and we try to hire patients whenever possible to lead classes such as our yoga series. And from the words of our peer volunteers, this program for many has allowed them to find a renewed meaning and purpose in their life, where they had been struggling before. Their role in the Thriver group is more than merely a participant. They are actively supporting each other through all the changes, milestones, highs, and lows of this journey. In addition to the opportunities to contribute to our program development and operation, we also support our survivors in their own search for meaning and purpose. We teach tools on how to live one's values and achieve dream goals in our Thrivers group, as well as offer occasional individual coaching to those struggling with life decisions. And finally, the cognitive rehabilitation process and the group goal-setting class led by the cognitive provider team helps the individuals tap into their life goals and move forward using their current strengths. So all of these pillars together create the Sherry Sobrato-Brisson Brain Cancer Survivorship Program at the UCSF Brain Tumor Center, a program that supports our patients in living a full, healthy, and empowered life. While we are still funded in part by our generous donor, Sherry Sobrato-Brisson, we are now operating with much more sustainability due to having services that we can bill to insurance, as well as by involving our incredible survivors in much of our program operations. So for institutions looking towards setting up their own program, I encourage you to first listen to your patients from the get-go, and perhaps you will also find those who wish to offer their time, talents, or funds to support your efforts. Look towards other models of care to get ideas of what has been shown to be helpful. Build your community of patients. This is one of the most rewarding things for patients, is to find others like them. And this often does not cost a penny. And leverage technology like virtual platforms to reach more people and save time and money on coordinating in-person events. You can also leverage skills and abilities of the staff you have right now who may be interested in starting a support group or leading a webinar. I want to thank you for your attention and your interest in this topic. I also want to thank Dr. Suzanne Chang and my colleagues in the survivorship program, and of course, Sherry Serrato-Brisson. And a huge shout out to all the survivors and thrivers who have been beside us all the way in the ongoing development and success of this program. Please feel free to reach out to me directly with any questions you may have. Thank you.
Thank you very much to Naomi for sharing this presentation with us. We had a similar topic last year, and we thought it was extremely relevant to reiterate the message again this year. So thanks to Naomi and to the UCSF team. I'd now like to move into kick off the panel discussion session, but right before that, we would like to play a video. We have Ashfaq Ahmed, who's joined us today. He joins our support groups regularly, and we've welcomed him to join the panel discussion today. Ashfaq Ahmed is a lab technologist at Mufti Mahmood Memorial Teaching Hospital in Dera Ismail Khan, Khyber Pakhtunkhwa, and was diagnosed with a non-malignant glioma in 2018. Mr. Ahmed subsequently underwent resection surgery in Rawalpindi and then cyberknife treatment in Karachi. Mr. Ahmed has been a fighter since day one and has turned into a brain tumor patient advocate and a source of inspiration for others. Despite being immunocompromised, Mr. Ahmed was the first healthcare worker who accepted the duty in his profession to collect the first COVID sample from the first quarantine center in Pakistan. This act encouraged other healthcare workers to join in the front line. He's been recognized for this act of bravery by Dawn News in a video, and I'd like to play that video to share a bit about his journey and the journey of others in his place as well. This video is in Urdu with English subtitles.
वक्त है रात के 3 बजे। मैं और मेरी टीम कोविड-19 के सस्पेक्टेड पेशेंट के सैंपल लेने के लिए जा रहे हैं। मेरा नाम इशफाक अहमद है। मेरी ड्यूटी कोरोना पेशेंट्स के सैंपल लेना है। जब कोरोना की वबा पाकिस्तान में आई तो एक खौफ सा छा गया था। सस्पेक्टेड पेशेंट्स के सैंपल लेने के लिए मुझे ड्यूटी ऑफर की गई। आज से 3 साल पहले मुझे ब्रेन ट्यूमर डायग्नोज हुआ था। सर्जरी और रेडिएशन के बाद किसी भी दूसरे शख्स के मुकाबले में मुझे कोविड से कई गुना ज्यादा खतरा था। लेकिन जहां इनकार के 100 बहाने थे, वहां ये ड्यूटी तस्लीम करने की एक ही दलील थी, और वही काफी थी। अपनी बीमारी और सर्जरी के दौरान मैंने मौत को बहुत करीब से देखा था। मुझे उम्मीद नहीं थी कि मैं बच पाऊंगा, लेकिन अल्लाह ताला ने मुझे एक नई जिंदगी दी। फिर मौत का डर नहीं रहा। बस इस नई जिंदगी का हक अदा करना था। केपीके के पहले क्वारंटाइन एंड आइसोलेशन सेंटर का मैं पहला बंदा था जिसने ये ड्यूटी एक्सेप्ट की। कोई भी ये ड्यूटी करने को तैयार नहीं था। मैंने अकेले 5000 से ज्यादा पेशेंट्स के सैंपल लिए। मारने वाले से बचाने वाला तो बड़ा ही है ना। कभी फैमिली का सोच के डर भी लगता था। डॉक्टर, नर्स, इन सब से पहले पेशेंट के साथ कांटेक्ट में आना होता था। जब ड्यूटी के लिए निकलता था तो घर वाले दुआएं अस्कार करते रहते थे। इस दौरान मेरी दादी की वफात हो गई। जनाजे पे नहीं जा सका मैं। सब दोस्तों और रिश्तेदारों ने मिलना ही छोड़ दिया। बस घर और ड्यूटी। एक बार तो एक सैंपल रात को कब्र में उतर कर भी लेना पड़ा। मौत के मुंह में ठहर के मौत को छुआ, पर अल्लाह हिम्मत देता है। किसी को तो आगे आना ही होता है। अपनी आंखों से कई लोगों को तड़प तड़प कर मरते देखा है। ये देखकर बहुत दुख होता था कि लोग मजाक बनाते थे। सब झूठ है, हुकूमत की साजिश है। अब हालात बेहतर होते देखकर खुशी होती है कि इस उजाले में एक किरण मेरे नाम की भी है। इस दुनिया में नाम, रिवार्ड ना मिला ना सही। अपने खुदा को ये तो कह सकूंगा ना कि जब कौम को मेरी जरूरत थी मैं सबसे अव्वल में खड़ा था।
Every time I watch this video, it brings tears to my eyes. I'd like to applaud Ashfaq Saab for the work he's done and for the inspiration he continues to be in our support groups every month. We'll now move on and use this as a kickoff to our panel discussion. We have all our panelists and speakers who you met already, and we have 3 additional members who you have not met yet. So I'd like to go ahead and introduce them, and if all the speakers and panelists would like to come on video, please go ahead. We have Yasser Hamdani, who's joined us. Yasser is a brain tumor warrior, but he does not let that be what defines him. He's actually a corporate lawyer and constitutional lawyer with a keen interest in digital rights. He's a barrister of Lincoln's Inn, holding an LLM and an LLB. He's also studied economics at Rutgers University in the USA. Mr. Hamdani is also the Asia Society Fellow and Harvard University Law and Human Rights Fellow. Some of his notable constitutional and technology cases include the YouTube unban case, which was part of the early digital rights legislation days in Pakistan. He's also the author of a widely acclaimed book by Pan Macmillan called Jinnah, A Life. He has also been the contributing author to the Print, Dawn, Daily Times, Express Tribune, Pakistan Today, The Hindu, India Today, Tony Blair Foundation, and Jinnah Institute. I'd like to welcome you, Yasser. We have Aisha Sarwari, who is with Yasser, as you can see. She's Yasser's spouse, and she co-founded the Women's Advancement Hub, WAH, the support grassroots women that supports grassroots women and helps tell women's stories across sections of society in Pakistan. Her NGO works to reform all sections of society by passing on the mic to women to tell their own stories. She is the author of 3 published books, a globally acclaimed public speaker, and a diversity advocate. I'd like to welcome you, Aisha. And finally, last but not least, we have Khushbu Lohan, who joins us from the Brain Tumor Support and Awareness Group in India. She has completed her master's in psychology, postgraduate in rehabilitation psychology from Punjab University, and is a Rehabilitation Council of India and accredited rehabilitation psychologist. Since 2019, Ms. Lohan has been providing real-time psychological support to brain tumor patients and their caregivers, continuously arranging monthly support group meetings in India, focusing on the rehabilitation of her patients, arranging financial support for needy patients, and providing educational guidance to pediatric brain tumor families. Her focus and specialization is on emotional support to patients with brain tumors. Thank you. I'd like to welcome everyone to the panel discussion today. Our topic is how do we provide end-to-end holistic care for brain tumor patients and caregivers in Pakistan and developing countries. Our moderators for this session will be Dr. Nitin and Suhaib Mehtab. Let's get started.
Thank you, Komal, for a nice introduction to this panel discussion. And I would like to congratulate Mr. Ishwaq for his dedication and devotion. And these are what motivational stories we are all looking at and would really help other patients. So my first question is to Ms. Laura. And Ms. Laura, I mean, you nicely presented the navigator concept. What we have realized when we have been managing the foundation is that whenever there are resource limitations, our counselors, they get busy with the new patients, and sometimes in spite of a lot of attempts, they are not able to follow up with their previous patients. Sometimes they're not able to attend to calls. So how do you recommend should this navigator be? Should this navigator be different from the counselor who initially approached or managed this patient? And how can they maintain the continuity? Because as the number of patients start increasing in this foundation, sometimes there is always a chance that some gets left behind. And each one has their own personality. And unless we make efforts to get in touch with them, sometimes they are not able to stay in touch. So, and second, is it important for the foundations to be providing these navigators, or can neurosurgeons or clinicians who manage these brain tumor patients incorporate them? And how can they, from which field can they incorporate them?
Okay, so I'd love to start with the second part of your question first. I think in remote settings, it's really essential from a lot of the things that I've heard today too. I think the idea of incorporating the patient navigator into the clinical setting from the get-go, especially since this is sort of a new novel approach in Pakistan, for that navigator to be part of the clinical setting from the get-go and really perceived as part of the care team may break down the barrier of losing that patient once they've left the hospital or the clinical setting, knowing that they are essential to the care team from the very beginning. It also breaks down some of the things that I've heard today that often patients don't want to ask for help, or they feel like there's a stigma to go that extra step for a patient navigator. So I think it would be really essential when kicking off this program to utilize them within the clinical setting, to initiate that from the beginning. And once this program really gets flushed out and an accepted part of the care team, maybe down the road, once there's more resources from foundations and that sort of thing, there could be extension into outside the clinical setting. So communication is something that I touched on earlier, and that is something that we struggle with as well, is losing the patient and how to manage the amount of patients that come through. And it's difficult. There's no easy answer to that. What we have done is maintained a sort of acuity scale, and we consider patients either active, maintenance, or inactive, and we put sort of a timeline on the cadence. And so a patient is considered active if the cadence of interactions meet a certain criteria. And usually those are the patients that are newly diagnosed, have the needs of education, they are looking for a clinical trial or a second opinion, but they're newly diagnosed and their needs for those patients are much more active, and we're interacting with the patient on a more regular basis. Once the patient goes into treatment and they're stable on treatment, they tend to get moved into a maintenance sort of category with our nurse navigators and social work navigators as far as the amount of times we interact with them. And then at some point, the patients become inactive, and we have a couple of different reasons why they become inactive. And that is either because the patient has decided that they no longer need our services, or they are just stable on treatment and it's gone more than 6 months since we've interacted with the patient. So if we haven't interacted with them in 6 months, they go to an inactive sort of acuity scale, but we reach out to them every 6 months or so just to check in. As far as deciding when to reach out to the patients, we often align our interactions with the patient, if we haven't heard from them, every 2 months, based on sort of in alignment with their MRI scans, knowing that a patient could be stable, they start standard of care treatment, and then they may have an MRI 2 months later. And we like to sort of coordinate our interaction with them if we haven't heard from them aligned with those scans, just checking in with them, asking how the scan went and that sort of thing. And again, that addresses the need. Sometimes these patients don't want to feel like a burden to us. And we want to make sure that we're there for them at every step of their journey. And again, it's part of that communication style. Sometimes the patients may not want as much of an interaction, and that's just really reading that patient, reading the room and understanding what their needs are, how they would prefer our interaction to be based.
Yeah, I mean, you very nicely explained. And just may I also ask you, because as the organizations get bigger, do you maintain the same navigator for the same patient, or do these navigators change for the patients?
Great question. And you know, that's actually something that we've learned in lessons learned, and we prefer, and the patients have preferred, and this is really patient driven, to keep the same navigator with the patient for their journey, and for the length of time that they're with Brain Tumor Network. Generally, most of the patients that come into our network are there for their journey. And, you know, as we know, with the higher grade gliomas, the life expectancy is not that long. So it's not, you know, it tends to not be that, unfortunately, that long of a time. Usually we are with the patient for about 2 years, sometimes more, sometimes less, depending on the individuality of that patient. But yes, they prefer to have the same navigator, so that navigator really knows that story of that patient. There's so much more to their clinical history and there's so much more to the patient and that relationship than the clinical history we found. And we've had patients that just call the navigators as soon as they come out of their clinical appointment, hearing the news that they've progressed, or we have the caregivers calling right away and saying, you know, this was what was discussed. What does this mean? As we know, the clinicians are just really like they're crunched for time, and often patients don't feel like they have the ability to ask all the questions that they may have. So yes, working with the same navigator, they know the history of the information that's been covered, and we really develop a lifetime journey with these patients.
Thank you, Laura. Yeah, Shred, please.
Taking the discussion forward, throughout the session, we've learned how important it is for us to have support group sessions embedded in whatever non-medical support system that there are in place. We have Khushbu in the call with us. Given the similarities between the cultures of India and Pakistan, I'm sure we can learn a lot from you and from your experience. So while dealing and managing with the support groups for brain tumor patients in India, what has been your experience? Which aspects of providing non-medical support could be tackled by you, which the clinicians cannot address? And also, very importantly for us, have you ever felt the need to educate the patients or parents in the case of pediatric cases on the benefits of a support group to encourage their attendance?
Yeah, thank you so much for inviting me. Yes, of course, there are so many challenges I, face initially while dealing or managing the support groups. It was very new concept for the patients, because as we all know, patients were so occupied with the medical conditions, and it was very new concept that we can call this emotional or psychological aspect with the medical conditions. And initially I have seen that patients don't have factual information about the brain tumor in terms of emotional aspect, not in the medical, but of course in the emotional aspect. And due to this condition, they face so many issues, and that how to handle the psychological, emotional, and psychosocial problems, and sometimes the logistical issues, because there are so many patients, like in India. They are very exhausted with the financial conditions, as brain tumor treatment is very costly. So while dealing with these conditions, I think, for my experience, we have to focus simultaneously with the medical conditions along with the emotional aspect. And since I'm a neuro rehabilitation psychologist, my role and responsibility was to deal with the psychological, emotional, psychosocial aspects. At a certain point, we have to be focused on the logistical needs of the patients, for the poor patients. So we arrange the funds for the through foundations. And of course, we can say that these are the conditions not covered by the clinicians most of the time, because they were so busy in their OPD, IPDRs, or surgeries. So, and third, you ask the education about the brain tumor patient and their family members. So of course, it is very important to educate, or we can say that psycho educate to the patients and their family members. And especially if we talk about the small children's, because at that time their family members, their parents were so occupied and so worried that how to handle and how to provide the emotional need to the children. Because I have personally seen some patients, and their parents also sometimes discuss with me that our children's eating habits are changing, their playing habits are changing, and their communication patterns are also changing. So it is very important, if the parents would know about the conditions and the challenges they would face in the future, so they can plan for this. And I think they can get enough support for them how to deal with the small children. So it is very important. And of course, in India, our experience with the brain tumor support group was, I must say, would vary. I'm so happy that our patients and their family members were so happy with us. And especially, and the last part, so if we arrange the support group meetings on daily basis, and I want to add one more point in this, because we have to be discuss with the patients on the daily basis. If we only discuss with the patients and we just invite in the group meetings, so they would not be preferred to come. So it is very important to arrange these meetings monthly, and because it can provide the feeling of, because we are not alone, the patient and their family members can understand, because we are not alone. There are so many other children's parents and the patients who are suffering in the same conditions. And of course, our main focus was from beginning of the time, real-time psychological support. And I personally feel that we should be focused on the coping strategies of the patients, because coping strategy enhance their treatment compliance also. And during the support group meetings, the all patients can also help to increase the coping strategy of these patients. So of course, cultural backgrounds, if we talk about the Pakistan and India, I think I must say mostly things are the same.
So it is very difficult in India also to educate the parents, children, and the brain tumor patients. So I think we should focus on the holistic approach and to give the equally importance to the emotional aspect with the medical condition.
Thank you very much, Khushbu. Very comprehensive response. Thanks.
Right. So my next question is to Dr. Asif. Dr. Asif, I was going through your presentation and I think I must appreciate the number of support groups you have for different conditions. And that is very heartening to see. And I'm sure it will be easier for you to take that experience on to start the brain tumor support group, because there are smaller number of patients. Definitely, it's more challenging. In the current scenario, clinical scenario, what limitations do you face when you deal with the patients? I'm talking more specifically about brain tumor patients. And specifically, when you discuss with your neuro-oncology colleagues, how do you try to break the news? Sometimes it's a MRI scan and there's a recurrence which is seen. So how do you try to get around these things with your patients in the present situation, and how you think you can overcome those limitations?
Thank you. So, yeah, I mean, as far as the support groups are concerned, I think having a support group for these CNS tumor patients would certainly help too. But as far as breaking the news, I think the major issues is majority of times for adult patients, the family comes in and tells the clinician that, please don't tell the patient about this diagnosis, because this is going to break that patient and this is going to be a disaster, and we're not going to be able to cope with all this, and he's going to break down and all that. So that's something that we really have to deal with the family a lot of times and tell them that this is very important for the patient to know what he or she is going to go through. And because the coping mechanisms have to come from the patient, and he or she needs to know what he or she is going to go through, the treatment, the diagnosis, the whole 9 yards, how the things are going to go, what he or she is going to face, as part of the treatment process is concerned, the surgery and everything. I mean, how can you really expect anyone to go through all these things without knowing what is happening? So that is a major issue that we face a lot of times. And then, as far as once they agree, and a lot of times they do eventually, once they agree, then, telling the patient as to breaking the news and telling them that all is not lost, and really, the treatment is there. There's possibilities of surgery and the radiation, and, the directed radiation, including the stereotactic radiation, the cyber knife and all that is available. And these have some really good outcomes eventually. So all those things need to be informed very meticulously to the patient, and they need to be taken on board. Maybe sometimes it takes multiple sessions, a couple of sessions, 3 sessions, for them to know and for them to eventually grasp that what is going to happen eventually. But the other issue is that we face is the literacy rate in this country, especially the kind of patients that we get who are on support or who are on 100% support. It's very difficult for them to grasp as to what is. I mean, sometimes it even happens that we tell them, and then the next time in the clinic they come in and they are completely blank, that what did you tell us, what happened, what is going to happen, am I going to be fine? And so all those things, it's very difficult sometimes for the patient to understand. So like I said, we have to go through multiple sessions at times. So yeah, I mean, these are some of the challenges. And I think with having a support group available is, even for patients who are starting treatment or who are going to be undergoing treatment, and having them meet the psychologists, the nurses, and the survivors, I think would be a big help, certainly. And I think we're probably looking forward to having a support group for the CNS tumors and the patients who suffer through them as well. This would be a big plus to add to our the number of support groups that we're running at the moment.
Right. And just one more, Dr. Asif, what is the perspective of the clinicians when you interact with them about these activities?
So The clinicians are all for it. I mean, like I said, we have that, we have a distress screening score that is always there, and that is part of something that they have to calculate for each patient who is actually on follow-up or who's coming to the Med-Onc clinic or the Red-Onc clinic. They have to have that thing. So the clinicians are all on board with this thing, and even if it takes multiple sessions or multiple clinic sessions to explain it to them, they're all fine with that. And they, as far as this making sure that the distress score is calculated for all the patients, this is also audited regularly as part of the pathway that we're involved in, and that is giving us 100% score lately for almost the last 7 or 8 months. So that's something very encouraging that all the clinicians are on board with that. For surgeons, obviously, we have sometimes what happens is the time constraints can be challenging because there are 2 or 3 surgeons. I mean, you have to realize that in Pakistan, it's not very easy to have people coming from abroad and then settling in Pakistan and being part of the hospital and staying there for long times. That is also a challenge for us. So that stays as the challenge, and sometimes it leads to time constraints with regards to the surgery. So we have to really mobilize the patients depending on their needs as to who really should be put on the list first, and rather than the other one, even though they might have been in the system earlier on and might be in the system for a long, but sometimes these patients who are more critically ill or who really need to be put on the list for radiation or for surgery for that matter earlier on, then we have to mobilize and make sure that the clinicians are on board with that, and they know we continuously keep sending the list of the patients to these clinicians to make sure that they organize the patients according to the needs of the patients and the criticality of the patient. So that's another thing that we continue to do.
Right. Thank you.
We're bringing the conversation close to Pakistan and the ground realities that we have. Ashfaq sir, thank you very much for joining us. As we've seen, your journey as a patient and caregiver has been very inspirational, especially if we look at the limited resources and the difficult times that we've been facing in Pakistan. As a patient, what has been your experience of getting medical attention and care that you needed during the COVID pandemic? Away from Karachi, where your treatment was taking place, and also in light of the recent floods in your town. Please do share your experience and learnings during this phase.
Thank you. Thanks for giving me a chance to represent as brain tumor patient to support groups, to experts, and to medical professionals. As you know, that most cities of Pakistan are not has state-of-the-art facilities for brain tumor surgery and radiation. Even I am a medical professional in a teaching hospital of Government Medical College, but in my hospital and in my city, there were not up to the marks facilities of brain tumor surgery and radiation. That was the reason I have to go to other well-developed city for surgery and radiation. For my radiation, after surgery, I have to go to cyberknife treatment, Karachi. I have to travel 16 to 18th hours continuously non-stop by bus, as in my city, there is no facility of train. There is no facility to travel by air to Karachi. The only way to travel to Karachi or a well-developed city is by bus, or is you are not public transport. If you are not going by public transport, you can go by your own transport, or your own facility. Due to my medical condition, as after surgery, brain tumor surgery, I was not be able to sleep in bus or take my head to back sport due to up and down roads of this area and continuous vibration in bus. This was not possible me to take sleep or take rest. 16 to 18 hours journey to Karachi. In COVID, when government banned on public transports, their time was much difficult for me to travel to Karachi for cyberknife radiation or for follow-up. I hope these are the realities, not only for of Deir Ismail Khan. Most of the 70% cities of Pakistan are not having up to the Mars surgery facilities, are not up to the Mars airports, are not motorways. I hope these things should be easy by providing better health facilities to faraway districts or hospitals from capitals or well-developed cities.
Definitely. And Ashfaq Saab, as Komal mentioned initially, I think your presence in the support groups that we have on a monthly basis brings a lot of encouragement and support to people who are joining the sessions. Because in these tough conditions, I think having people like you, continues to provide inspiration to all the people who are, going through similar experiences in Pakistan. So thank you very much for that as well.
Yeah, thank
There
you.
is interest.
Yeah. Yes, Ishwak, please.
There is interesting story for Brain Tumor Foundation group that I remember that it was the 28th December 2018 when two surgeries done by two neurosurgeons in two OTs at same time. After surgery, two surgeries mean one was of mine and one was other patient. After surgery, I was feeling better, but other patient was not be able to move hands or legs. Both was having trigeminal neuralgia history, which was diagnosed as a tumor on right CP angle. Both biopsies sent for histopathology at same day, and both biopsies report received at same day. I was diagnosed as benign schwannoma, and other patient was diagnosed as malignant tumor. Me and my family was in touch with that patient even when I discharged from hospital, and continuously on weekly basis or daily basis we will call to their patient, and we will in touch. We were in touch. One day I know that their patient was died, and this thing was not acceptable for me. I was 10 days in ICU and hospital after surgery with that patient. This thing was not acceptable for me, and me was not thinking positive or for a few days in shock. After joining the sport group, Brain Tumor Foundation, I get chance to meet other peoples like me, other caregivers like me, and start thinking positive. I met here many peoples, and I listened their stories, patients and caregivers of their journeys, and this helped me to become stronger and positive. Another benefit I have got in this group when participants demands for some topic like exercises for brain tumor patients, like diet for brain tumor patients, like psychologist to arrange a psychologist for our caregivers regarding society behaviors. This is most helpful for patients and for caregivers that we demand, and Komal fulfill it.
Great.
I hope this group will be more fruitful for patients and caregivers in future. Thank you.
Thank you very much, Ishfaq sir. Thank you.
Thank you, Ishfaq. Very nice. I mean, you have explained, and this has been our experience. The patients do get strength from each other. They have an attachment with each other, and it helps them. And so my next question is again to Yasir. And Yasir and Miss Aisha, so good to see you after 1 year. Last year we saw you, and I think you have been doing remarkable work, as I discussed with Komal. So just, I mean, you have gone through the whole process. Want to ask you that what all things, if I ask you maybe 3 to 5 points, which you felt could not be addressed during your course of treatment and recovery, and how you think these can be improved. And this is not specific to the medical part, it is the other aspects during the course of treatment and recovery.
Yes, I think one of the things that I realized was the dearth of resources when it comes to reading up. There's nothing specific to Pakistan which deals with the kind of special challenges. So, for example, as Ishfaq Saab was saying, the travel bit, for example, was a huge thing during the pandemic. However, even afterwards, when one came back and one was here, what about, sort of getting back to work, getting back into the daily routine of life, the rut, all of that was not available. There was no guidance on that. So I think that is something that we need to have some kind of a support system for people who are trying to get back into or trying to become productive again. I think one of the challenges that I faced throughout was the fact that I was bedridden for a long period of time, and that itself had sort of an emotional and psychological challenge for me because I'd been working for so long. And so getting back into just a work routine took me, 1.5 years after the second surgery. I'd gone back really quickly after the first one, but the second surgery, it took longer. So I think that is the kind of stuff that there has to be some kind of guidance, people who've gone through this, to actually go ahead and sort of come up with kind of a rule book for brain tumor patients. Don't do this, don't do that. For example, after my first surgery, people after my first surgery didn't tell me that once you survive, you have this idea that you're on the top of the world and you can just get away with anything. To that kind of self-confidence, which is bullish almost, was unnecessary, I think. And somebody should have said, listen, hang on, you just came out of a surgery, just go slow. So that kind of thing, I think, was there has to be, I think there isn't enough psychological help out there for people who just survived a brain tumor. I hope that makes some sense.
Yes, I think you very nicely pointed out, and I would briefly say that maybe a social integration, and once you are through with the treatment, how to integrate yourself into the society. And this is where I think we need to step in. We need to sort of lead or guide the way to proceed further. Yes, Shoaib Saab.
I'll go next, actually. Thank you, Yasser, for sharing that, and thank you for joining. It's good to see you both again. Aisha, I'd like to ask you more from a caregiver's perspective, as I've been one to just want to understand. I mean, I follow you on social media as well, and I see all the many different things you do to try to cope, right? And to stay strong. I think yoga and meditation are some of the few things I see you do. But I wanted to ask, like, what are those things that you do to stay strong for Yasser, for your two girls, for yourself? And where do you think, these sort of services could be offered to the broader brain tumor community? I mean, you might be seeking them out yourself, but how do you think we could actually provide that to everyone else?
Thank you, Komal, and it's really nice to see you, Dr. Atharnathan, all the people that we met last year. Funny thing, when we were doing this conference, Yasser said, were we there last year? And I said yes, because half the time he doesn't remember things he's experienced, said, or done. And I think that is pretty much, the life of the spouse of somebody who has a brain tumor. It kind of takes away your person while he's still there. It makes you grieve for the loss of the person that you once knew, and yet you have to continue within the same context of a relationship as if nothing has changed. So it's a bit of a, apologies, you're all very learned people, and I shouldn't say this, but it's a bit of a mind fuck. Due apologies. It's like somebody has told you that everything is okay now because your husband's survived 2 open craniotomies with the wonderful surgeon that we have here, Dr. Atharnam, who frankly did not just give us life, he also gave us movie recommendations, which, by the way, I'm happy to report we have now watched Bohemian Rhapsody, and now we know why you told us to watch it. Because without meaning, you're not going to be able to do this, and where do you find meaning? I think it's just somebody needs, just like somebody should have sat Yasser down and said, the steroids you're going to have are going to make you feel invincible, and you're going to do the most ludicrous things, and you're going to ruin all your relationships. I wish somebody had sat me down and said, he's going to do that, and it's not on you, And so I feel like the best people are the people who catastrophize brain tumors and tell you your life is never going to be the same, and it's going to be terrible, and you're going to lose your mind, and you're going to have nervous breakdowns, and your children will not get the medical or other attention they need, and everything will be diverted to the person who's sick, and you will sort of fade, And it's very hard that in South Asian cultures, the people behind the people who are sick are invisible. And I think we need to call that out. That's a toxic culture. The people who do not recognize the caregivers in these societies have a problem inherently in them. And it's time to say that is something that we need to absolutely change. I found myself completely at a loss. And the three things that rebuilt me, Komal, as you've rightly pointed out, are the mountains. I just came back from K2 base camp hike. And the only person who kind of saw that I was fading and I needed the mountains was Yasser. Like, I actually pulled out at the last minute because I'm always afraid that I'll leave and he'll die, right? But he got me the hiking boots, which was very metaphorical in a lot of ways. And it's also that we know that we've lost each other in so many ways. But we have to keep walking.
I think, Aisha, this is a very valid point which you have made. And this is, I think, the society issue, and it's changing. In our own practice, we now see that the parents come and tell us that you need to tell the spouse of the patient to, or the mother or the father or the son to take care of himself. But yes, it's still a very steep uphill journey. And I'm so happy to see both of you. I mean, I was asking Komal, and you two do motivate me, and it's wonderful. And
so Nitin, I have a funny story. I mean, sorry about the tears, but somebody from Archon called me the other day for an annual survey, and so this intern, really sweet young doctor. She's like, "Hi, Aisha, sorry, you're the primary caregiver of Yasser Hamdani. I'm in the middle of a board meeting," and I'm like, "Hey, can I call you back?" She's like, "Is this a good time?" And I thought this was got to do with Yasser, so I said, "Yeah." And she's like, "Okay, so question number one, is he still alive?" Right? Because and I say, "Yeah." And he's like, "When was the first surgery?" Like 2017. When was the last one? 2020, I think.
2020.
Yeah. And she was rather impressed. She's like, guys lived quite a while. Like, she was actually, like, from a data perspective, quite impressed by the whole thing. So I think that the best thing about having a brain tumor is that you get entered into this club of amazing human beings. Yeah.
+1 to that.
Right. Yeah. Wonderful. I mean, Shannon, I'll try to get your inputs here, and hearing from both of them and also from Ishfaq Saab. I mean, how do you or how does your organization plan to, at what stage to step in, and at what different stages of the treatment, what points to be discussed, and the person who is the navigator or the person who is going to be in touch, because they also need to understand what stage the particular person or the disease is in. So how do you decide these various combinations? You must be having some protocol or some.
Shannon, could you hear it, or should I repeat? Yeah.
Yeah, sorry, it was cutting out there a little bit. If you could repeat that would be wonderful.
Yeah, I mean, what I was asking is, listening from Yasser, Aisha, and Ashfaq Saab, how do you decide at what stage to step in? and what seniority of the counselors to step in at what stages?
So we don't do exactly the same things that the Brain Tumor Network does as far as that the guiding of the patients and the navigation. So we really are here for when patients reach out to us. And so unless they've been referred to us by a caregiver, a physician, a healthcare professional, we really are here for when they reach out, and then we're able to provide them with resources, support groups, those sorts of things, making connections for them. But it really is, it's guided by our patients, by our caregivers. It really does initially start with a conversation when they've reached out. It's often they've heard of our handbook, so they've reached out to ask for a handbook, and we connect them with a social worker that we have on staff who will sort of talk through some of those things. And just as Aisha said, right, really acknowledging this isn't just about the patient. There is a family involved, there are caregivers involved. And so we find ways to support the entire unit as they go through it.
Right. So that's a slightly different perspective of what we sort of do here, but I think very important. And also your fund development concept was very good. And I think what we need to ask also is how, because you have been working now for 40 years, how do you build the credibility to your activities? Because somewhere down the line, when we approach, there is a fear amongst clinicians and also amongst patients that there could be some inherited interest of the person who is referring. So how do you try to build your credibility? And also the persons who give funds to you, how do you maintain credibility that that fund is being used for the right way? So it is both ways, credibility for the clinicians, for the patients, and the fund givers.
Yeah, absolutely. Great question. So I'll start with the relationships with the physicians and with our patients, with our community. So I would say this is where the collaborations and the alliances really come into play, because in the initial stages, I mean, we've been around for 40 years, as you said, but you know, we did have to start somewhere. And so I think you really need to rely on the expertise within your organization, but also the expertise available to you outside of your organization. So the people that we are connected with, our physicians, our neuroscience scientists, our board of directors, those are people we make sure we establish those relationships with people who have established credibility within the community to begin with. And then I think, just as Brain Tumor Foundation of Pakistan has done by bringing us here today to share, building relationships with those other established organizations helps to demonstrate to your community, and that's, you know, the medical community as well as the patient and caregiver community, that we are able to support them. And some of the organizations, I mean, they were mentioned and talked about today: Brain Tumor Network, Sontag Foundation, International Brain Tumor Association. It's all about identifying those alliances and developing the relationships that you can count on for support until you've established sort of that credibility on your own. And then with the donors, it very much is about transparency and, again, the relationships. What we have with our donors is not just a receiving of their funds and that's all that they do. They very much stay involved with how our funds are spent, where they're spent. They're aligned with our mission. And so, and we keep them updated. And that's, I think, a big part of it, is that they can see exactly where the funding is going. They can see the benefit. Some of those achievements that I highlighted, our donors, our funders, and our physicians, they know that's where the funding is going and they're seeing results. And so it maintains that relationship. They want to continue to stay involved.
Right. That's very, very important. And we have been struggling a lot. And I think most of the organizations do struggle a lot with the fundraising. Yes, Komal, back to you.
Great. Thank you so much, Dr. Nitin and Sohaib, for moderating, and thank you to each and every one of you for participating today. I think this session has been very insightful for each of us in different ways, and extremely important and critical that we talk about these topics every single time. I'd like to thank each of the organizations that spoke today, each Ashfaq Saab, Aisha, and Yasser for taking the time out and joining us today and sharing their personal stories with us. Special thank you, to PASNO and Dr. Thernam for inviting us and for making sure this topic is always at the forefront, at his symposiums, at these annual symposiums. And Dr. Inam, I could, I think, go on for another hour just to thank him and talk about the work he's doing for the foundation. He's been nothing short of a source of strength and inspiration for us. He's the one who called me in, I think it was August 2020, to say that I'd like to start a patient facing organization, and you'd once talked about setting something up like that. Would you like to set it up now? And we've come a long way, but I constantly look to him for support and guidance. And now to PASNO and to the other experts who are joining us, and to the other brain tumor foundations that are now our family. So I'd like to maybe just request Dr. Nam to join me in some closing remarks before we conclude the session today.
Thank you, Komal, and Assalamu alaikum and namaste and good morning and good afternoon to all those over here. I mean, first of all, I just want to thank everyone and the group that we have over here, all who take care of brain tumor patients and those who have suffered the other end. And I think this is one of the most important session of this annual symposium. And thank you, Komal, for doing it in such a wonderful way. It just changes my personality when I go through this thing. My thinking, my thought process, it just changes whenever I go through this thing. And I want to maintain that for the rest of the year until the next NOS comes up. So this is a great session. I want to thank Yasser and Aisha and Ishfaq Saab, who's new this time, is that what you are doing is no less than what a radiation oncologist or a medical oncologist or a neurosurgeon can do for a brain tumor patient. The support that you provide to another brain tumor patient is as valuable or even more valuable than what these physicians and surgeons can do for the brain tumor patient. We see patients on a daily basis, and we have to move from one patient to the other patient, and we just cannot carry the whatever we feelings that we have from one patient. We can't carry to the next patient. We have to, like, just like between two sushis, you have to take a ginger. Between two perfumes, you have to smell coffee bean. That's what we have to do between patients. We have to move on to the next patient. And then when we go to the family, we can't just carry it to the family either. So people like you provide that very deep and very broad base for the brain tumor patients. So it's very important role. And in that, I want to mention one more thing, Komal, that what you're doing, don't ever think that you are just following something that's being done somewhere else in the world. It's not so. Along with Shannon and Laura and Susan Chang and all those who were the last year, you are a trailblazer. My brother had adenocarcinoma, and he is in the Southern California, Irvine area, the richest area, managed care. I went there for him when he had his surgery and his treatments. And I did not see this kind of support that what you are providing at this point, or what Shannon or Laura is providing. So let's not assume that what you are doing is something that is copying something else. I think along with all these great people, including Shannon and Laura and all the things, you are actually creating a totally new paradigm. You are trailblazers, I would say. And I think all tumor patients, all cancer patients, all complex disease patients need that kind of support. So thank you for doing that. really. And I only hope that in future when we work together, we are able to gather enough funds to have one navigator for each brain tumor patients as they come out of as they go into the treatment and all the protocols. And I'll just take a couple of more minutes. I just wanted to thank everyone, including these conferences. They have their own value. Sharif Charania is a gentleman who I think he is still. I don't know if he's still on or not. He is still on, actually, yes. So these conferences, they mean a lot. They do a lot of things besides your session. And there are a lot of academic activities that go on. There's a lot of networking. So we had surgeons come from Vanderbilt, Reed Thompson and Michael Dewan, and they are into global neuro-oncology. That's a concept that's coming up. We had a wonderful session with Rakesh Jalali yesterday, and Vijay Patel, and we had MD Anderson people, Vinay Purawali, and then we had Bob Carter from MGH Harvard. We had my own mentor, Mark Rosenblum from Michigan. So all these people coming together in these conferences, it means a lot. It produces a lot of results. So besides academia and research and what we can do to improve the outcome of brain tumor patients, we provide that very significant aspect that we as physicians and academicians tend to ignore. So you balance that. But this all thing is done by one gentleman, and that is Sharif Charania. He manages that. He's a magician. He's a genie. We just have to rub it, and then he say, "Tell me what I have to do." So thanks a lot for Sharif for doing all these things, and we will keep on doing this every year, inshallah. So once again, thanks to all of those who are here, all the listeners, and I hope that we keep on moving and making it better over years, especially with the fundraising, so that we can have these navigators for all the brain tumor patients. If we do that, we are ahead of the game. So thank you very much, Komal. And obviously thank you, Nitin and Mehtab and Asif and Khushbu and Ishfaq, all the names that are in front of me. I'm just reading those names. Thank you.
Thank you very much, Dr. Nam. Great. We'll conclude our session today. Thank you to all the audience for joining, and thank you once again to all the speakers and panelists for joining us today and participating. We'll continue and make progress. Take care.